Doctors of Reddit, what patient made you go how the fuck are you even alive? We had a guy with a major aortic dissection one night. From the bedside ultrasound, he looked like he had already bled out. He had some chest pain, but he was alert and oriented, and we were shocked he was even still alive. He absolutely shouldn't have been with how much blood we saw, and the size of the dissection. We called the surgeon in, who was really blunt, and explained to the guy he was probably going to die in surgery. He was a young guy, like late 40s. He was on a business trip, and it was completely unexpected. He kept trying to call his wife, but it was like 2 AM and she wasn't answering. He just wanted to talk and tell her goodbye. It was actually pretty devastating to watch. Meanwhile he's so coherent and alert, as if he isn't actively bleeding out and dying. Most patients we would get in the same situation wouldn't be conscious, or would already be dead. They swooped him off to surgery before he could contact his wife, and the dude lived. Remembering that story got me through a lot of tough years in the ER, because I think it just reminded me that hope and good outcomes are still out there. Edit. Geez, this blew up. I picked up my phone this morning and had no idea what happened. Thanks all for the awards and the interesting discussion. To those of you with similar stories, know that you are the reason a lot of providers keep doing what they do. Some of your experiences are unbelievable. I'm still trying to read through all the comments to clarify some things. Late 40s is too young for this kind of case to happen. We usually see people dissect in their 70s to 90s. Also late 40s is a pretty young age to die, especially if you don't have any chronic illnesses. A couple of weeks ago, my ed lost a 30-year-old to COVID-19. A couple of nurses cried because we consider people twice his age still pretty young. This happened when I was still a tech and had only been in the ER for about a year. He was brought in by EMS, uncomfortable, but definitely awake and alert. His ECG was normal, and he didn't have any pertinent history, just chronic HTN and a few minor surgeries. But he was hypertensive and really pale, and when we performed in the US, we found what looked like a huge volume of blood in the abdomen, and a visible intimal tear. We pretty much immediately diagnosed him with AD, and had vascular surgery in the room within a few minutes. I followed up on his chart a few days later, and found out, not only that he was alive, but he was already extubated and able to walk. I'll try to keep sorting through comments. I'm surprised that this isn't as uncommon as I thought. I was on a home call for the ER in a small town. Got a call from the ER nurse one night, and she was like, "EMS brought someone in here, and they think she might be dead." I was like, "Well, is she?" She was like, "I don't know." This was a seasoned RN, by the way, so I was like, "Well, guess we are treating this as a code blue kind of situation." So without any further information, I jumped into my car and rushed over to the hospital. Once I got there, I realized why the triage nurse was so confused. In the trauma bay lay what appeared to be skeletonized remains under a blanket. The person felt warm to touch, so I opened their eyes, and a yellow, wrinkled, shrunken eyeball stared at me and then suddenly moved. Potassium of 1. For those familiar with lab values, the backstory was extreme self-neglect/depression combined with carriage-over neglect. Weighed in at 67 pounds at a height of about 5 feet 5 inches. We actually resuscitated her, very aggressively, and unbelievably, after about 8 liters of fluid, she started speaking a word or two at a time, and recognized her daughter. Patient here. When I was 2, I was being treated for asthma due to wheezing, labored breathing, etc. One night it got exceptionally bad, so my mom took me to the ER. They put me face down to do a cord scan. This was 1990, and when they were done, they turned me back over, and I was blue, had stopped breathing. Court revealed a volleyball-size mass in my chest. Emergency surgery revealed what was supposed to be my twin. It kept growing inside my rib cage and finally had nowhere to go in my toddler body, so it cut off my airway. It had fingernails, hair, appendages, everything but major organs. I made a full recovery. I'm a healthy 31-year-old now. Zero asthma. Only remnant of that night is a scar that goes from the center of my chest to the center of my back. Update. Definitely didn't expect this to blow up. Damn. Thanks for my first gold. This was a teratoma, so it was never a viable human. Edited the post to show that I'm a healthy 31-year-old lol anybody that quoted White Scroot as my hero. Obligatory not a doctor. I'm a funeral director and I received the body of a 90-something man. I could tell he had been sick for quite some time, just by looking at his face. Another funeral director did the embalming, so I hadn't seen the rest of his body. Seeing that he was so old and just looked sick, I was surprised when I met with his daughter and she inquired about an autopsy. I asked her my usual questions and discovered that this man, for 40+ years, had unregulated diabetes. He was shot on 3 different occasions in his life. He had a history of strokes, bed sores, deep ones, in and out of the hospital for sepsis, pneumonia, heavy smoker, heavier drinker, suffered a major heart attack just days before. His vision was going, and he couldn't keep himself awake, horrible jaundice, cirrhosis, had an infected kidney removed, on and on. I don't think this man lived one healthy day in the last 20 years. I ask the daughter, so, you want an autopsy because, she tells me that her father was not an ill man, and it was not his time to go. She's furious. I even questioned her request. I'm baffled that this man lived for 90+ years. The denial people can experience in hand with grief is astounding. So not the doctor but the patient. I had a super bad allergic reaction. That was a specific type of allergic reaction that was deadly on its own. It would have been deadly if I had only taken a small bit of the medicine I was allergic to, but the doctor that prescribed it accidentally prescribed about 10x more than what the maximum dose for that medication is supposed to be. So not only was I super allergic, I was also overdosed on what I was allergic to. So that led into weeks of me being in the ICU and doctors thinking I had about a 3% chance of surviving at best. Every time I was conscious and had family visiting, a doctor would tell me to make the most of it because I probably wasn't going to make it for their next visit. Eventually I somehow recovered, but for about 2 years after I was still regularly going to several doctors to make sure different things were okay that were affected by it. Every single doctor I went to would hug me and would have other doctors and nurses come in and say something like, hey, you don't remember this because you were unconscious at the time, but I helped restart your heart, or I was the person that vacuumed the blood and pus out of your throat that was blocking your air path, and they were just all amazed that I made it. It's been about 8 years since it all went down, and I've run into several of the doctors and nurses around the city, and they still recognize me and still hug me. It amazes me how in such a large city with such a huge hospital that gets the most extreme medical cases from around the world, that they still remember me being there. Edit. Sorry everyone, I posted this before I went to sleep and didn't check it until after work today. As for some of the questions, it was Steven Johnson syndrome. Definitely look into it because it may be the closest thing to hell on earth. Your body looks and feels like it's been through a fire, and it leaves a ton of permanent damage. Actually, I was one of the worst cases of it, and I'm referenced in some studies, just not named. As for the medicine I took, I don't think I should say, because I'm not supposed to talk about the situation and I think people could easily relate it to me. I was actually misdiagnosed for the meds that gave me the allergic reaction. After I got to the hospital they asked why the hell I was even on it, because I had no signs of the thing the medication was for. Not a doctor, but I had a few doctors ask me that. Typically, if you get appendicitis it'll rupture and sepsis will set in within a day or so. And when that happens, it gets real bad real fast. So I got appendicitis. It freaking hurt so bad, but I didn't know I had appendicitis. I went to the doctor, he couldn't tell what was going on. He thought I had impacted stool and wanted me to take stool softeners. So I did. It didn't help. Cause spoiler, it was appendicitis, right? And then a roommate who thinks he knows what he's talking about tells me that it's all in my head and I just need to physically get off the couch and exercise because he feels much better after he exercises. Okay dude, I can't even get off the couch to use the restroom without almost passing out in pain. He tells me to just play a video game to get my mind off of it. I go to class, grad student at the time. I called the doctor and made another appointment. He doesn't know what's going on. I talked with another doctor, no clue. He thought maybe it's appendicitis, but I didn't have a fever and didn't have a recoil pain. So maybe it was gastrointestinal stuff. So I scheduled an appointment, meet with them. All the while I'm going to class and taking the maximum dosage of all pain relievers I can get my hands on. And finally the GI doctor scans showed that I had appendicitis. Hooray. I go to the nearest and I say, in a totally calm tone, "Hi, my name is so. My doctor said I should probably go to the because my appendix burst a while ago and it should probably be taken out or something." Turns out, my appendix burst and I held on to it for 3.5 weeks. I had a dozen doctors come in and some of them even started by saying, "Hello, my name is Dr. such and such, and I heard that you're the guy who has had a burst appendix for nearly a month and you're still alive. I'm not in your case, but I just wanted to meet you. How the hell are you still alive? How the hell did you drive yourself here and just waltz into our I got that alien bioengineering ring upgrade where the abdomen moves around and wall seals off the burst appendix so it doesn't leak everywhere. Point at it. After my primary care physician learned I had appendicitis and he didn't diagnose it, he retired within a month. It was probably coincidental." I'm not a doctor, but I do know a story that surprised most doctors. I'm currently 19 years old. My childhood was quite normal at first, but everything became quite dark when my grandfather got cancer in his testicles. When he started chemotherapies, everything was very hard for him and for the whole family. My cousins and I used to visit him after lessons. A couple of years passed and our grandfather recovered from cancer, but the smile was erased when they told us that he had metastases, so the cancer spread to the part of the rectum. He had to start chemotherapy again. Luckily the cancer was not as serious as the previous one. Although it sounds strange, my grandfather survived and was cured of the second cancer after a year. There were no longer any forecasts of any other terminal illness. At 17, my grandmother passed away, which made our grandfather move with my family, but being quite impatient, he would go out from time to sunbathe and feed the birds. He went to the park by bus. One had done at night and my grandfather had not come home. He took the bus, but the driver was drunk. The bus crashed. 4 people died and 7 survived, of which my grandfather was. We did not realize that he had disappeared that night. The next morning we found him in the hospital sitting as if nothing had happened. We all burst into tears as he complained about the decanter while laughing. My mother joked that God had forgotten to take our grandfather to heaven. This year my grandfather got the flu and we went to the doctor. After writing the medical history, the doctor almost dropped his eyes when he saw that he was still alive. I had lost a lot of blood to anemia and went to the doctor for something else. She starts looking into my eyes, my gums, pinching my cheeks, and telling me that I'm severely anemic, and then said, "Are you always this white and pale?" And then I'm like, "Yeah, I guess." And then she made me take a test. Turns out my blood level hemoglobin was at 6.5 and dropping because of my heavy menstrual cycle and stomach issues not absorbing iron. I had gone to the doctor because I had really bad heartburn, and it turns out that I was really low on blood. It explained all the dizziness, coldness, eating ice by the pound, auditory hallucinations were happening, and I started to just not care about anything. Had numbness in my whole body as well, and trouble breathing. I'd been in such a dire state that I started to accept all of these things as normal. When I checked myself into the I told them that my doctor told me to come in, but I think she was overreacting, and I can probably just go home. They quickly tested me. My blood level had dropped a little in a couple of days, and I still had heavy menstruation. They quickly admitted me to start my blood transfusion. They said that had I waited I would have likely gone into cardiac arrest or would have just died in my sleep. After the blood transfusion I felt amazing. I could breathe and my skin color was back. I'm a hospital medic and my first serious trauma was a guy that got shot in the neck. Somehow it missed everything important and went right through. Minimal bleeding, no C-spine damage. Just a hole through his neck that didn't pierce his esophagus, trachea, or any major vein or artery. Dude was just chilling in the room point, and then 2 weeks ago we had a gunshot that would not have made it to the local trauma center. Hit his ephemeral vein, but was still gushing blood. One nurse stuck her finger in the hole, and it stopped the bleeding, and I found a second wound in his chest. No bleeding at all, it just looked like a weird indentation. We couldn't even tell it was a gunshot at first, and I stuck an 4th adhesive sticker over it to vent it and prevent a collapsed lung. The guy's blood pressure was in the toilet and wasn't even able to read on the machine. We needed a manual check. By the time we got him sort of stable and with decent vitals and got a surgery team in early, we were drenched in this guy's blood. Pretty sure most of what was flowing through him was saline and other people's blood. He survived though. We also had one woman whose entire abdomen was fully open under her belly and everything in her was horribly infected. We basically told her we can't stop that much infection and she opted for hospice care. She was in so much pain I don't know how her family even got her to the ER. I lifted up her gut to look underneath, since I was the first in the room to assess, and I was hit by one of the most rancid smells I've ever experienced. Literally everything from the waist up was infected. There were some unnatural fluids draining right out of the completely open bottom of her stomach. I mean it when I say you could just lift it up and look right inside. Not a doctor, but a registered nurse. Last summer between the months of June to September we had a young male, 19 years old, who crashed his motorcycle and was sent flying through a van's windshield. By the time he came onto my unit he had gone through so many operations, and I heard he needed to have over 100 blood transfusions within the first month to keep him alive. He also ended up losing all movement and sensation from the belly button down, as well as losing his left arm. His right arm was intact but barely functioning. Neurologically he was with it, knew his name, and that he was at the hospital, but I honestly don't think he knew what happened to him. His family members were very nice, and I could only imagine how they were feeling. I honestly have no idea how he was still alive. He couldn't sit up straight anymore because he would be in terrible pain 24/7, but if we laid him flat he couldn't really clear his secretions. I'm surprised he didn't get pneumonia or aspiration or something else. We discharged him to a long-term acute care facility and that's the last I heard of him, but it's just such a sad story considering he's only 19. Two patients that give me faith in what medicine can do when I think about it, both quite young to be so sick. First was a woman who was very pregnant and some genius doc agreed to put her under twilight anesthesia for an elective procedure that definitely could have waited. Went into labor while she was under, and from there everything went wrong, ended up in cardiac arrest. Was transported to my hospital and put on VCMO. She was in rough shape when I saw her first. Most people in her condition don't make it. I ended up seeing her a month later walk into my op clinic, and I got the creepiest feeling. It was like seeing a ghost. She was fine. Not like most people who come out of the ICU after that kind of stay point. The second was a young guy who bled out in the ICU of a sudden hemorrhage. He was pulseless for an hour. Without going into a bunch of details, he required several procedures after that which were risky on their own. It took weeks for him to reboot, but eventually he was responding to stimuli. After a couple months he walked out of the hospital. He wasn't dying, he was dead for an hour. That these two survived is a testament to modern medical science. That they walked out of the hospital on their own, needing little to no assistance, and with their cognition completely intact. That is a miracle. Edit. I remembered another one that was pretty wild. This guy had very advanced cancer which had invaded the major blood vessels of his abdomen and chest. When they took him to surgery, his vena cava was involved, and it sounds like it just unraveled. They were not ready for a major cardiothoracic procedure, so they were just dumping blood products into him to keep him alive, while they could get someone to repair this major vessel. I thought the op report had a typo, because they said the estimated blood loss was 30 L. I forget the breakdown, but they had put hundreds of units of blood, liters, and liters of crystalloids and plasma. It's about 6x the blood in a normal person. He was white as a sheet for weeks after this, but he made it. Currently a med student, but was formerly a nurse. While working as a nurse, I had this one patient who was originally from the Congo complaining of right lower abdominal pain, with a subsequent diagnosis of appendicitis. Nothing crazy about that. See it every day. The crazy part was the story he told me next. He said that he didn't think it could be appendicitis, and when I asked him why, he told me this: when he was in the Congo, he was out in the bush trying to poach gorillas. Awful, I know. When he developed right lower abdominal pain, nausea, fever, etc. Being out in the bush, far from medical attention, he and his buddy decided the best course of action was to cut open his abdomen with a machete and remove his own faking appendix. After nearly dying from the surgery, he then went on to nearly die from sepsis over the next several weeks. I assume he was under medical care by this point. Somehow, he manages to overcome nearly impossible odds and survives, and years later immigrates to Canada, where he develops appendicitis again. So after hearing this, I was equally amazed as well as skeptical, but he showed me his scar, which I thought was fairly validating. I told his surgeon the story and asked why he would still get appendicitis, and they said he most likely just didn't remove the whole thing. I know this is all hearsay, and it is definitely possible it was exaggerated or even entirely fabricated by the patient, but if it's true, it's one of the most baddest things I've ever heard, and definitely belongs here. Not a doctor, but my future brother-in-law was definitely one of those cases. When he was about 5 and my fiancée was 10, their family went to visit their grandparents who own a significant amount of land. Grandparents gifted my fiancée one of those mini 4-wheelers for kids. This thing did a significant amount of speed. I don't recall how fast my fiancée said it would go, and grandparents obviously made a rule that brother-in-law couldn't ride on it alone, and both had to wear helmets at all times. Well, brother-in-law really wanted to ride it and snuck on when nobody was looking and just took the fuck off. About 30 feet before slamming straight into the back end of the grandparents' Suburban. From what my fiancé has told me, brother-in-law cannot remember any of this accident. It was bad. He cracked his skull, tons of stitches all over his face, knocked out some baby teeth, and wore headgear for almost a year because he faked up his head. The doctors told my in-laws that it's amazing he survived, and a miracle that he didn't have permanent brain damage. He's a pretty cool kid now at 18 and will be my fiancé's best man. This was many years ago, so I can't recall the exact details, but basically, we had a lady on ventilation with sepsis and multi-organ failure. Renal failure, respiratory failure, metabolic acidosis, deranged liver enzymes, the whole works. We counseled the family and they agreed to withdraw life support, so DNR was issued, and we took her off her ventilator. A few days later she's still around, unconscious, still in full-blown sepsis with multi-organ failure, but brainstem functions were there. I remember looking at her charts with my registrar, I think resident in the US, and my registrar going, "But how?" Then, one day, maybe about a week on, during visiting hours, the patient's son approached us before he left to thank us for looking after his mother. His parting words were, and I kid you not, I don't know if it's relevant, but my mother practiced black magic. My registrar made the ward sister contact the hospital chaplaincy team to inquire if they do exorcism. They don't. First day of my emergency medicine clerkship, I saw the wheel of a motorcycle accident guy who had dozens of broken bones, arms, legs, skull, etc., amongst significant soft tissue injuries. GCS was in the single digits. Had a decent pulse when they brought him in, but it was fading fast. Fast scan showed he was pretty much bleeding into every space in his abdomen and pelvis. The guy looked dead. His co-rider had already been pronounced dead in the field. Hands and feet were the same color as the white sheets on the gurney. Pulse was barely palpable. Lips were blue, etc. Anyway, the trauma surgeon apparently sees something or has a flash of inspiration. I stepped away for like 5 minutes while they were putting in chest tubes to go check on one of my other patients in a different room, because as I head back over to the trauma bay, they're whisking this guy off to the OR. I heard from a nurse the next day that they cracked his chest, called in vascular and cord surgery in conjunction with the trauma surgeon to stop all the bleeding, and then closed him up once he was hemodynamically stable, but obviously in grave critical condition. There was no telling in the short term what kind of neurologic deficits he'd have from the fact that at one point, 80% of his blood was chilling in his abdomen, rather than his vessels. Hell, I didn't even know if the guy's spine was intact, or if he'd be paralyzed just from the physical trauma. Anyway, lo and behold, exactly 30 days later on my last day of emergency medicine, I bump into the guy and his family members leaving the hospital through the main lobby, holding fresh discharge paperwork in hand. He's being pushed in a wheelchair, because you can't really use any arm strength without splitting your sternum open after the kind of surgery he had, but dude looks good. He's laughing and joking with his wife, and trying to tell her that he can walk out of here if they'd let him. Pretty crazy considering, when I saw him, he was pretty much a broken corpse. Not a doctor, but one Friday around lunchtime I started having pains in my stomach. Thought maybe I pulled a muscle at work. Pushed through the pain till Saturday morning. Woke up in the worst pain I ever felt. Only time it didn't hurt was when I tried to pup. Went to the talk to a doctor, and get a CAT scan. While in the scan I started throwing up this black sheet. I was rushed to the OR. Well, I was freaking out and no one was giving me an explanation as to why I was being rushed to the OR. So I pulled out my IV and walked out. Went home and the hospital called me 140 something times to try to get me to come back in. Sunday morning came around and I felt like death. I fell out of bed and couldn't get up. My ex-girlfriend calls 911. Paramedics show up and say, yeah, we've been waiting on you to call. Find out my appendix ruptured Friday. When I woke up Tuesday, the doctor made sure I knew how lucky I was to be alive. He also asked me to sign a disclosure so he could share my story and pictures of my appendix in a book he was writing. Said I was minutes away from dying due to being septic. Not a doctor, but I contracted meningitis when I was 2 years old. I was rushed to the hospital and the doctor immediately diagnosed it and had me sent via ambulance to the children's hospital an hour and a half away. A small town doesn't have the resources to fight such things. The ambulance actually broke down about halfway there and they had to send another one to pick us up. I spent 2 weeks in the hospital and the doctors kept pansy-footing around when my parents would ask about my condition, and they kept getting vibes of it's unlikely he lives through this, but they just didn't have the heart to tell them. For those unfamiliar with meningitis, it can be very lethal, and even those that survive often have a lot of complications like limbs that are amputated or other defects of the body. After 3 or 4 days in ICU I finally started reacting to the treatment. Not only did I survive, but I also walked away with only 97% hearing loss in my left ear. No amputations and no other defects 26 years later, and here I'm typing this story out while I rock my 2-year-old to sleep. Just thought of a case I had while working in stroke rehab. Not a doctor, but I saw her scans. Like 60-70% of her brain is gone. The woman had a headache years ago when she's in her 30s. Went to the ER and doctors told her it's a flu, gave her painkillers and sent her home. Needless to say, it got worse. She went to the hospital again after at least 24 hours. Think she waited for hours in a bed before getting an MRI, and by then, according to her family, she's already not that conscious. The doctors said it's a small hemorrhage that bleeds slowly, and the tear got bigger. She got emergency decompression and clot evacuation, but it's still 36 to 48 hours too late. She lived because the op saved her brainstem, and her family is well off enough to afford care staff and continuous rehab, but her mentality is like a baby and she could not even sit up. Sometimes I wonder if saving her life is the right thing to do. Obligatory. Not a doctor. Got a call at work that my partner at the time came into the ER after an accident. Was told he came in semi-conscious, but was alert now, etc. Don't rush in, because it's not critical, but come in as soon as possible. I spent maybe an hour chatting with him, who was indeed alert and normal, joking with doctors and nurses, before being asked to join the nurse in the hallway. Dude's back was over .40. I knew what that meant, because as a bartender I've taken enough certification courses to understand back. Plus I studied enough neuroscience and anatomy in college to know where the line is between dead and alive. He was well past where the dead should be, or at least comatose, plus had been thrown headfirst into a tree from a moving car, but he was just chilling cracking jokes. Even had a mostly intact recollection of the night and the crash point. The look on the nurse's face when he told me the back is one I'll never forget. I know higher levels have certainly been recorded, but it was pretty clear this guy hadn't seen one and was beyond shook. It was a wild ride. Not the doctor, but the patient. Obligatory. For some backstory, I've always been a fairly tall and lanky white boy, and had a pretty bad bout of walking pneumonia at 15. Later on, I had a spontaneous pneumothorax at 18, my lung popped. I was sitting out on the back porch of parents' house, texting my girlfriend at the time and just generally taking in a nice quiet afternoon in rural Vermont. Fuck, was it a nice day. My brother came home from a class, union piper fitter, and asked if I wanted to go somewhere. Can't recall. I shot up from the chair, and I felt a weird sharp, almost cold sensation in my left side. I didn't think anything of it, and we made our way downtown. I'd been feeling a strange twinge every now and then from the left side of my chest, but nothing bothersome enough to worry me. After a good few drinks and several hours we made our way home. As I crawled my ass out of my brother's shorter sedan, sure enough I felt that strange sensation in my right side this time. Still not really a clue what it is. Didn't really feel like a big deal. My breathing was a smidge harsh and my left side hurt a bit from earlier, but I figured I'd just faked a muscle somehow. I woke up about 9 hours later. I can barely breathe and hardly move. Every upper body movement is a faking task. I managed to roll off my bed and crawl out of my room. I'm on the basement floor, first floor for Europeans. I'm gasping for air with every swing of an arm to drag myself closer to and up the stairs where my parents are having breakfast. I get to the top stair and I'm wheezing, shallow breaths because I can barely breathe. I'm damn near sure I'm about to die. My mom rushes me to the and tells the staff at the desk I'm fucking dying, not far off from the truth. I get rushed into radiology to confirm what's going on and to see the extent. Both of my lungs are about 90% collapsed. I don't recall much after walking into the My O2 sats were faked and I was already losing consciousness. But I woke up about 12 hours later with 2 tubes in either side of my back draining the air. I had surgery a day later to remove blebs, skin tags, from the surface of my lungs. Since then, I'm A-OK. Open water and Nitrix certified for diving, avid hiker Wartnet. My thoracic surgeon was faking shocked I hadn't died in my sleep given how far gone my lungs were and where my O2 sats were at by the time I got in. Not a doctor, but a witness of a doctor saying this to my grandpa. The guy was not even 40 when he was diagnosed with esophagus cancer which had spread to his lymph nodes in his neck. He was operated on, but was told he would probably never be able to eat solid food again, and had difficulty speaking, as the main tumor was located on his larynx. Chemo and radiation was used to treat the spread in his neck, but there was a high chance he wouldn't survive it as the smaller tumors were inoperable. He survived. He learned how to swallow again, and regained his speech. All was good. Then he got a stroke within the year. Doctors thought it could be his artery in the neck, damaged from radiation treatment, that created a clot. So as he had just recovered, he was now unilaterally paralyzed by the stroke, and again unable to speak or swallow. Years later, he is now able to speak and swallow again, and part of his paralysis is recovered, or he has a way to work around it. Cue to him being 50, cancer strikes again. He now has tumors in his prostate, which has spread to his testis. They remove most of it, and radiation and chemo do the rest. Now the poor man has no testosterone production anymore, so he is put in artificial testosterone. He is now almost 80, and a few years ago they found multiple dormant tumors, some in his bones, and one in his prostate. They have been treated with chemo, and are now under control. He is weak as a stick sometimes, but always recovers. His doctor said to him the last time he was in the hospital that he had never seen a person going through so many illnesses and cancers for 40 years, with each one a slim chance of survival, but always recovering. My grandpa, a slightly religious man, said, "When the angels are calling, and I think I might finally lose the fight, I turn off my hearing aid, so I keep fighting." Patient here. I had a giant tumor pressing on my spinal cord. It's a kind of tumor that is super rare to be located in the cervical spine and exceedingly more rare to have so young. When the doctors found it, they said I could been paralyzed from the neck down in a month or so. I was in surgery in less than a week. The tumor was also pressing against the important artery that is right next to that area of the spine. There was a chance I would bleed out during surgery if it was accidentally nicked. Also, the surgeon said that if the tumor had damaged the nerve ending it had started to grow on, then I would lose usage of my right arm. I'm only 21 and I'm right-handed. 6.5 hours of surgery later I woke up with an 8-inch incision down the back of my neck and no in-surgery complications. My arm works just fine and I have all the feeling back in my body that I had lost. I'm finally able to tie my shoes again after losing fine motor movement in my hands. I have an appointment on Thursday to see if the tumor is growing back at all. Wish me luck. Not a doctor, but a ski patroller at a major resort in Utah responded to a skier versus tree call. Never good. He hit the tree going really fast. We showed up and the guy was literally wrapped around an aspen. He wasn't breathing, so we pulled him off the tree to open the airway. He gasped and coughed and blood flew all out of his mouth, but he was breathing. We moved him into a better position to work on him, cut his shirt and jacket off, and his entire chest was smashed way past flailed chest. It seemed like all of his ribs were broken. His skin looked like it had sticks all under it. He is gasping and blood is coming out of his nose, mouth, even his eyes are bleeding. He stops breathing. We start CPR. I remember doing compressions and I could feel his bones poking my hands. We worked him on scene for about a half hour while the flight crew showed up. When they got there, the flight doc put a tube in to drain his lungs of blood. He put the tube in, looked at me, and said, "Hold this drain so it all comes out." So I grab it, and blood comes out like a garden hose. Soaks my uniform. It's all over me. So much blood. The snow is red all around. They load him up with a pulse and take off. After they left, myself and another patroller stayed to shovel up the bloody snow so the other guests wouldn't see too much. Then I had to go in and turn in my uniform and shower. As soon as we first showed up, we thought this guy was going to die on the mountain. Turns out the guy made a full recovery and brought us all a few cases of beer the next winter. Skiing is dangerous, so all be safe about it. I was caring for a patient on the med-surg floor in nursing school whose kidneys were basically non-functional. His bun and creatinine were through the roof. I'm fairly certain his car was in the 60s and his girlfriend was 3. Girlfriend basically shows how well your kidneys are filtering and is supposed to be above 60. These guys weren't doing shit. I asked my instructor what kidney levels were supposedly fatal and she said that before that day she would have said this guy's levels were. The guy was refusing dialysis too. The nurses made it sound like they had tried to educate him, but when I went in there and asked him about it, he sounded very unsure and said his main reason was that some of his friends said not to do it because it sucks. Found out those nurses actually just sucked and didn't educate him at all. So I told him, I really think you need to at least talk to the doctor about that option because it is probably going to be necessary for you. I hope he took my advice. He wasn't there when I came back the next week. Sadly, I'm a little late to this party, but I thought I would mention a man I once treated as a patient many years ago when I worked in a small town by the sea. I will call him Mr. M. Mr. M was a small town solicitor. There are not so many of them left in the UK now, but Mr. M and a couple of partners worked in a small solicitor's office, doing the usual round of wills, conveyancing, small-time disputes between neighbors, and so on. Mr. M was middle-aged, very overweight, suffered from a high blood pressure and diabetes, and not a very active man. He was married, and Mrs. M was his opposite, thin, anxious and a bit overactive. They had a childless, rather unhappy marriage. For reasons not relevant to Mr. M's story, I knew Mr. M's health problems had him marked for an early grave, and that if we could get his weight down, his blood pressure and diabetes, neither of which were well controlled despite everyone's best efforts, would improve. Naturally I spent a lot of time trying to deal with this issue, with the usual round of advice, referrals to the dietitian, diet sheets, regular weight monitoring sessions etc. Nothing made any difference at all, despite Mr. M continuing to sadly tell me how hard he was trying, and how carefully he stuck to his diet. One day I think my frustration started to show, and Mr. M seemed rather sadder than usual. I took a new tack and asked him, very sternly, to take me through what he did and ate on a typical day. We chose the day before. Slowly and reluctantly this was his story point. When he got up in the morning he would go downstairs for breakfast, made for him by his wife. Breakfast would be 2 rashers of bacon, 2 sausages, 2 fried eggs, a fried tomato and a slice of fried bread. This he would follow with 2 slices of toast and marmalade. And coffee with cream. Arriving at work he would have a cup of coffee and 2 or 3 biscuits. After a couple of hours work he would walk down to the local baker's to buy a cake or donut for a mid-morning snack. Sometimes he said he would be hungry enough to buy 2 cakes or donuts. Around 12:30, exhausted and hungry, he and his partner would walk over to the local pub, where he would drink 2 pints of beer and have lunch. He quite liked the pub's pie and chips, but sometimes he would have steak and chips instead. He would usually follow this with something like apple pie and custard, or chocolate fudge cake with cream. In the afternoon his snack was usually only a couple of chocolate biscuits. This was all bad enough, but then he told me that on the way home, this would be between 5 and 6 in the evening, he would stop at the local fish and chip shop for a meal of fish and chips with mushy peas. When he got home his wife would cook him dinner. Usually this was some sort of roast, perhaps roast beef with roast potatoes, veg, gravy, and Yorkshire pudding. Followed by a dessert, perhaps apple pie, or maybe trifle. Oh yeah, and they always had a bottle on wine between them. After his wife went to bed, he liked to sit up and watch a film on the TV, accompanied by a liter of Coca-Cola, not diet of course, and a family bag of some snack or other, or a packet of chocolate biscuits. He took no exercise at all. Remember, this was back in the 1980s. This revocation absolutely stunned me. No wonder this chap's health problems could not be controlled. After I left the area, having made no headway on his problems, I used to go back from time to time to visit, and occasionally would see him around town. Usually in the baker's house. How continued to stay alive remained a mystery to me. Not a doctor, but was told by the head surgeon that I was the strangest case she had ever seen in her 20 years. I was walking home, and a lady was doing 65 miles per hour on a wet road you don't do 30 on. She struck me and sent me flying 40 feet through the air, through a barbed wire fence, shattered my left leg in 12 places, blew my right knee out, bruised lung and kidney, and a crapload of circulation damage to my legs, and a major cut across the top of my head. The doc said normally a person with that much trauma is normally out cold or screaming to be put under. But when the helicopter landed, had to be life flighted, the nurse and pilot were laughing their asses off. Doc said she was a bit pissed until she came up to me. Seems I was cracking really dark and bad jokes all the way up till they knocked me out to prefer life-saving surgery on me. She said before they started to work on me, she had to wipe away the tears of laughter she had. Not a doctor, so a little shaky with medical terms. But you might be interested to hear about my grandmother. When she was 36, she had a debilitating brain aneurysm. She spent almost 100 days in the hospital, during which time one of her doctors just shrugged at my grandfather and said, "I don't know, her heart just won't stop beating." A few years later, she had a stroke that paralyzed the right side of her body. She's been mentally handicapped and in a wheelchair since then. A few bouts of pneumonia here and there. When I was in high school, she got diagnosed with breast cancer, had a single mastectomy, survived. 2 years later, colon cancer, also survived. She's now 72, and a few months ago we found out she had bone cancer. She had surgery to plate her left femur because it was almost entirely eaten away, and since then she's been on a slow decline. We put her on hospice care a week ago and are preparing for her to pass peacefully, but it's like her doctor said, this woman's heart just won't stop beating. TLDR, my grandmother has survived everything. I'm in her document. I had a sweet little girl accidentally get caught on some rope that wrapped around her neck while going down a slide, causing her to fall off the side and hang herself. Her dad does CPR on her until paramedics arrive. She came in with a pulse but not breathing. We put her on the ventilator, but couldn't get her oxygen up because the lungs fill with fluid after hanging. She got put on an ECMO machine, oxygenates blood and bypasses the lungs so they can heal, which was a Hail Mary at this point. In the ICU she develops abdominal compartment syndrome and has to have her belly opened up at the bedside. She then proceeds to lose her heartbeat 8 times, including 3 times from developing a spontaneous pneumothorax, and once from a nurse tripping over the ECMO power cord lol, and the doctors and nurses in the ICU get her back all 8 times. She survived it all, and was discharged from the hospital 100% neurologically intact. Kids are amazing. I visited her before she got discharged and cried with the family seeing how great she looked. Best case of my career. Not a doctor, but this happened to my godfather a decade or so ago now, and a number of years after his quadruple heart bypass. He was hit by a street racer. The other car was going 200 km/h and struck the driver's side door pylon. The fire brigade thought he was dead when they were cutting him out of the car with the jaws of life, but nope, still alive and sent to hospital in an ambulance and arm brace. A couple of arm x-rays later, and they discharged him the next day with a broken collarbone, calling him bloody lucky. He goes back to work loading trucks that afternoon, arm in a sling, joking that his wife hit him and broke the arm. A few days later he starts swelling up. As a Maori he wasn't exactly small to begin with, but he really started ballooning. Back to hospital for a few tests and the results come back in, and the doctors are like, how the hell does this guy have spinal fluid in his bloodstream? A bunch more tests are done, including more extensive x-rays. The results come back in. The top 3 or 4 vertebrae in his neck weren't there anymore. They'd dissolved from the impact of the crash, and he'd been working, heavy lifting, and generally going about his day with only the fat and muscle of his neck holding his skull in place. He's immediately immobilized and gets several emergency bone grafts to rebuild his neck, and thank God they take, and he was able to get back to his normal life of loading and driving trucks. Obligatory not a doctor, but my mom has been this patient to a couple of doctors. She suffered from severe pneumonia for almost a year. Same story over and over. She couldn't breathe, would go in, get diagnosed with pneumonia, then go home with meds. Finally, after about the 5th time of this happening, she was diagnosed with emphysema. She was in rough shape, couldn't breathe at all, and we find out one of her lungs is completely shot, filled with liquid. They do what they can, and suction as much as they can. She was in hospital for 2 weeks. I live out of state and flew home to be with her for the 2nd week. Finally we got some good news, and things are looking up, and my mom is to be released from the hospital the next day. Well, that day comes, and she's eating breakfast in her hospital room, and goes into cardiac arrest. The doctors resuscitate her, and have to put her on a ventilator. We find out one lung has practically completely failed, and her sternum broke during the resuscitation. She was on the ventilator for over a week, when the doctors and my family had to make some hard decisions. My mom has decided in her will that she did not want nutrition and was a DNR if this were to ever happen. So that being the case, we had to make the horrifying decision of taking her off life support. The hospital had the hospice team meet with us to start understanding grief and loss. We eventually took her off the machine. We were told that the sedation would be reduced and we'd get to say goodbye. This was supposed to happen within 2 hours. Well, 2 hours passed, and then 4, and then 6. And nothing happened. Eventually, a few days later, after not being able to speak from the machine, she sat up and said what the hell happened, and she improved and got better and spent months in rehabilitation. And now she's home with my dad, on oxygen, but alive. And I'm so faking happiness and so proud to be the daughter of such a fighter. If anyone feels like they're lacking hope right now, just know that anything is possible. Never give up hope. My grandma was not an alcoholic, was actually a nurse who had been married to a doctor. She didn't trust one of them, lived on scotch and cigarettes, mean as an old coot, drove every day, right up against the wheel, with a cigarette dangling in one hand. Refused to wear a seatbelt, carried a gun everywhere, fiercely independent, could not stand the thought of anyone taking care of her. In the end she had a stroke. It didn't kill her. Laying in bed and developing pneumonia is what did it. Last words she said to my mom, her daughter, were I'm gonna sue you, because my mom allowed the doctors to drain her brain. She kept asking for Mr. R.J.R. Reynolds, and when she finally went into a coma she still brought her hand up to her mouth, like she was smoking. She went from stroke to death within 2 weeks. And thank God, we miss her, but she would have been a real witch to take care of in an impaired state. Not a doctor, but this is about a friend of mine. He was biking to work one day, and he got hit off his bike by a bus. He then got run over, his whole body did, not once but twice, by the front wheel and back wheel of the bus. Someone spotted it, and called 911. By the time he was in the ambulance he was in a coma. They didn't think he'd make it. Took him a week to wake up from the coma. When he did, he was partially paralyzed from his neck down and couldn't talk, but they could say, "Hey, can you hear me?" And he could kind of nod. They did reconstructive surgery on his back and ribcage, which was all mangled, and while they were doing that he got a major infection. They thought that was the end. They had to remove a ton of bones from his back and replace them with metal, do a ton of skin grafts, etc. He somehow miraculously becomes stable after recovering from the infection, but he still couldn't stand up or talk. He spent a total of 13 weeks in ICU. He then did physical therapy and eventually he was able to talk and then walk. If you look at him now, unless he takes his shirt off, he looked like a pretty normal guy. He walks a little funny, but all in all, I think, how the fuck are you even alive? Not a doctor, but I baffled one once. Punched my brother through a window when I was 13. Long story short, no dimmer switch. I was either 0 or 100, and back then my anger was released externally. Suicide / several nicks in my hand and wrist, and another slash on my forearm / elbow. Doctor said with the amount of blood everywhere that he would have expected it to be from 2 large adults fully exsanguinated, and he had no explanation as to why I was otherwise perfectly normal. That is, never got dizzy, didn't lose color, fully coherent the entire time. I spent the entire time ragging on the Bear Grylls episodes on the TV and teaching the nurses about solar stills and how to desalinate water. Only things I said about it were jokes. Made a joke about the water temperature when my mom sprayed the hose on me, and that the saline being squirted into my gaping wrist felt so wrong. Started the day wearing a white shirt and powder blue shorts. Came home that night with a brown shirt and midnight purple pants. Not a doctor, but the patient my neurologist was totally confused by. At the age of 21, I began having episodes of semi-consciousness, which lasted 2.5 months. My doctor could not figure out what was causing the problem, even with repeated blood tests. Then one Monday night, I prepared for bed. The next thing I knew, it was Friday afternoon. I was intubated, hands and feet bound to the hospital bed. Come to find out, my seizure medication had stopped flushing out of my system and was shutting down my body. My sister had found me on the floor beside my bed on Tuesday morning, seizing in my own vomit, which I had aspirated. I apparently spent the majority of my time seizing over the next 3 days, as my doctor kept changing medications to stop the seizures. He had told my family to start funeral proceedings sometime Thursday. On Friday afternoon, I awoke, scared to death by my situation. Not only did I survive, but so did the child I was pregnant with. Unknown to anyone 30+ years later, I'm still plugging along, and that child has children of his own. Until retirement, my doctor continued to refer to me as the one patient he would always be amazed by. So not a doctor, but rather the other end of that question. Simple answer. I had a hemoglobin level of 3.2. Long answer. I developed a rare and aggressive autoimmune disorder that basically destroys my blood. This was the first time it happened to me, so we didn't know what was going on. But basically fainted twice, went to urgent care, they immediately called me an ambulance, was still coherent at this point, got to the ER and that's when it goes blank for a few days, life support. Maybe a week later I got moved to a telecom unit, just monitor you 24/7 via patches on your body that lead to a little box that is monitored at a nurse station. That's when I got assigned to a CDC doctor, who I'm sure, while reviewing my jacket, was all sorts of confused. I mean sheet. The automated counting machine for blood basically spat out a message saying incompatible with human life. Edit. In case you were curious, the disorder is called chronic idiopathic autoimmune hemolytic anemia. If I recall right, it was warm, not cold, plus some other attributes I can't recall and can't access my files online right now. I was on the patient side of it. It was a while ago, so I don't remember all the names of the bones/breaks. But anyway, I was thrown forward from a bucking horse. Broke my back in 7 places, from my lumbar up to my cervical vertebrae. Mostly fractures, and 2 vertebrae that were compressed. They had broken so bad. There's a joystick-shaped joint between your C1 and C2 vertebrae in your neck that control the rotation of your head. I can't remember the name for it, but I broke that as well. Then lastly, a minor fracture at the base of my skull from the riding helmet I had worn. After finding all of this out with tests, x-rays, etc., Doc told me he was shocked I was alive, let alone that I wasn't paralyzed. Told me he'd seen someone with fewer fractures, in the same spots as me, that never walked again. All I needed was a body brace and C-collar for 2 months and physical therapy. No surgeries needed, and I haven't had any problems since. And I'm forever grateful for that miracle. Guy walks into my area in a major city, known for crime and drugs. Think The Wire. He says he got stabbed. Vitals are okay. BP a little soft in the low 100 range systolic. There is some blood on his shirt and we lay him down, and he takes off his shirt. He has a stab wound straight to the center of his chest. In trauma we call this the box, because it is a square area on the chest where the major vital organs lay, and is right where the heart is. He seems pretty calm about this, and I asked how long ago it happened. About 30 minutes, I don't know. How long does it take to walk here from X Market? FYI. The location, he said, is a good mile away, and he passed another hospital, a major trauma center known worldwide. To get to me point we do our ABCs of trauma. We remove the rest of his clothes and search for other wounds, and then I do an ultrasound of his heart to look for blood pooling around the heart in the pericardium. The heart sits in a sac that, if the heart is punctured, and blood leaks out and pools, the blood can compress the heart and cause circulation to stop because the heart can't beat. This is called tamponade. Of course, there is blood in the heart sac point as I do this. I look up, because his blood pressure bell is going off, and it is now reading in the 70s. I try to talk to the patient. He is still conscious but very drowsy. I immediately ask the nurses to call everyone. Surgery, anesthesia, and put a call into the major trauma center to get ready to receive a puncture wound to the heart. Surgery is down in an instant, and says if his blood pressure goes any lower than the surgeon plans, to crack his chest right here. Anesthesia isn't here, so of course that means I have to intubate him, put a tube down his throat to help him breathe. If the surgeon plans to do a thoracotomy. For reference, this is an 75-year-old surgeon on call who mainly does consults and very minor surgeries the last few years. This is a small hospital and we don't have much support. He's well seasoned, but hands and voice are a little shaky. Do I trust him to fix the guy? Sure. Do I want to intubate this hypertensive patient whose blood pressure is going to drop more by me pushing positive pressure into his lungs with a ventilator? No. Is he better served by going to the trauma center 1/2 mile down the road? Yes. I had to think fast. Tamponade can come from many causes, and in non-trauma cases, docs are trained to do a pericardiocentesis, sticking a needle in the sac surrounding the heart, and draining any liquid that's in there. Usually it's plasma. No reason I can't do that now, right? At least to stabilize the guy enough to send him to the trauma center. The ambulance is on its way. So I grab the biggest needle I can find. The heart is deep. I'm talking about 6 inches long, which 4 needles is fairly large, and I use my ultrasound as my eyes and jab this thing into the guy's chest. I know what you're thinking, Pulp Fiction style, but no. The needle goes more in the lower chest upper stomach area at an angle and you gently guide it using the ultrasound to see that you are on the right track. There is no going through the breastbone like they do in that move. As the needle advances, dark blood starts pouring out into my syringe, and I pull out 200 cc, about a Coke can volume worth of blood. We recheck his blood pressure, and it's going up into the 120s again. I and the surgeon breathe a sigh of relief. The guy's more awake, but still in a haze point as the ambulance crew rolls up to the room to emergently transfer the patient. The hospital security officer comes up to me. He says, so that guy who got stabbed, I had to convince him to come to the He was outside smoking a joint and said he wanted to finish it before he came in. Faking. Guy, no wonder he was so chill. TLDR. Guy walks more than 1 mile past the trauma center to go to my small hospital with a stab wound to his heart. Survives to be transferred by sticking a needle in his chest to drain the blood. Really chill throughout. Turns out he wouldn't come in the until after he finished his blunt. There was a time when my mother had some dude come in a prison jumpsuit with no guards. So naturally she sees this and freaks out and starts yelling at people to grab him and handcuff him to a bed. So a couple actual officers end up going in there and trying to get his information as everyone is very convinced he's a felon. Well, the dude starts screaming he's not a felon and this is just a prank. He stays strapped to the bed. He insists it's for a YouTube prank. And at this point everyone is still like, what the fuck? Well, it's not, until his producer shows up, that my mother realizes she just ordered a couple officers to handcuff some dumb pussy outer who came into a hospital in a jumpsuit to the gurney. I believe they apologized to my mother and the producer for a misunderstanding. But while it may have been a prank to him, it quickly was depicted as a threat to everyone else, and he was no longer having a good time. Makes you wonder how he made it this far doing dumb shit. I'm not a doctor, and whilst I had cancer I wasn't expected to be able to move due to my WBC being astronomically high. Leukemia is something that is normally ground in about 6 to 10 weeks after development. It took almost 5 months to find the cancer. The day after diagnosis in March 2017 I went to my specialist hospital. Apparently the doctor said back quote is that I was 12 and at a children's hospital. As I walked past, they hadn't seen me before and they knew all of the kids there. I walk past and go back to bed point. They explained to me that I shouldn't have even been able to move around in bed. My blood levels were so low. They didn't recognize me, and a few nurses refused to believe it was me as I shouldn't have even been able to walk point. They were even more shocked when they found out tattoos in the past 6 months I had only had half a day off a few days before. And I had cycled to school every day including that morning, and swam at my swim club 6 days before. Many people with leukemia can't walk for long, or at all, after having leukemia for about 6 to 12 weeks. I had it for about 4 to 5 months. I'm now in remission, and have been, since July 2019. I'm so faking glad that my teenagers kicked cancer down the faking stairs, and hopefully I can keep it down there for the rest of my life. Fat cancer. Yeah. Not a doctor, but I was a hospital chaplain. We had a guy come in on ice. He'd had a cardiac event and fallen off a roof he'd been working on and had been mostly without a pulse for nearly 40 minutes. We'd prepared the family that there was almost no chance the guy would make it at all, but the docs managed to keep him alive and he got a heartbeat back, though he was still in a coma. Docs told them he'd probably never wake up. After about a week and a half he did. Docs told the family he might be able to move his eyes around, but he would likely be so damaged he'd be able to do little else. Long story short, after 40 some days in the hospital, the guy walked out under his own power, with some aid for balance, speaking some Spanish and English again. Don't get me wrong, he wasn't back to normal and had a long way to go, but every single person on the medical staff agreed he had absolutely no business even being alive, much less that. Consensus seemed to be it just wasn't his time yet. Patient. Here, I had a doctor ask the question at 10 years old. I fell on the edge of a playground. At 10 years old, I fell on the edge of a playground and tore my spleen in half. Horizontal tear that managed to rip it into 2 pieces and tear it completely clear of my stomach. I was bleeding so much internally that I was vomiting said blood out, but the school nurse waved it off for some reason or another and tried to pretend I was fine for a few hours. 4 hours, if memory serves. Eventually she condescended to contact my parents, who immediately called an ambulance to transport me to hospital, who ran an ultrasound, cursed, and transferred me to another hospital. Because they didn't think their surgeon could handle it. I was not staying conscious. I was in and out multiple times throughout being asked a simple question. Which was when the doctor, who may have been the fourth one to come in during my everything is a blur, warned my parents they did not have high hopes of me making it through surgery and to say their goodbyes. I was awake to hear that, and I was frightened, despite being completely shell-shocked. I do remember vaguely thinking that, if death was this confusing jumble as you fell in and out of sleep until you stayed there, that it really did feel more like drowning than falling asleep. I spent 5 weeks in the ICU before being transferred to another part of the hospital for final recovery. I also, apparently, lost something like 9 units of blood. The surgeon came up when I was released from ICU to shake my hand and to tell me he had no damn clue how the hell I had managed to survive long enough to get to his table. Even being semi-conscious didn't make sense to him. We joked about me being immortal, and he went on his way. This was my stepdad. Massive heart attack at age 67, on a rural road in a rural town. Should have been dead right there. No pulse at all. But as luck would have it, he's walking to have his dog put down at home, with the vet. Vet does 13 minutes of chest compressions. Not good. Ambulance finally shows up with defibrillators. Gets a rhythm during the 30-minute ride. Weak as sheet. Probably going to die. I get the call. Drive 2 hours there. If he's not dead, he's probably brain dead. We, the children/stepchildren, pull out the ICU doc and tell him that in addition to this, he's an alcoholic and a heavy user of pain meds. Also, a lifelong smoker. Could barely get out of recovery for hernia surgery due to low O2 stats last time. Not great. Goes through withdrawal. Body isn't fighting infections so well. Can't seem to breathe on his own for an entire week. Try and fail to extubate several times. Can't keep up O2. The longer the tube is in, the worse the prognosis. Anyways, one day we all leave and go to Dairy Queen or some shit. Decide to get drunk as siblings for the old man. Wake up the next day. He's extubated and we can come. Expect the worst. I brought him his Cubs hat so that if this is how we are going to remember him without tubes, he at least has his hat. Walk in, expecting him in a coma. Tough old sob is sitting up, talking. I tell him the Cubs won opening day and that the first pitch of the season was a home run by the Cubs leadoff hitter. He says Schwarber? I said no. He says, oh, of course, Hap. I lost my sheet right there. Obligatory. Not a doctor, but was a corpseman on a ship. Guy comes in. Says he's thirsty like all the time. Okay bud. What else? Proceeds to stick his hand in the waistband of his pants with room to spare. Oh sheet. How long? Couple weeks doc. Run poc glucose. It's 250. Sheet. It's a small boat. We don't have the resources for this guy. Get him medivaced. Of course he gets grounded in Scotland because a volcano erupts. Scottish military hospital won't treat him because he's American. Can't get a hold of us. Continues about his business. Finally flies back to the States a week later. Fortunately listens to my advice and goes directly to the Glucose is now 450. The doc has no idea how he's conscious ICU for a few days. He's now normal as you can be with diabetes. No clue how he survived a week with uncontrolled diabetes somewhere between 300 to 450 glucose and didn't have more problems. The human body is amazing sometimes. I had 2 patients come in on the same day who made me ask myself the above question, but for 2 very different reasons. The first one was a male in his 20s who had been starting to learn surfing, and on his 2nd or 3rd time out, he got dumped by a wave. The fin of his surfboard hit him on the edge of the bridge of his nose, bouncing between his nose/eyeball to lodge itself through the back of his eye socket. His face was basically split in half, with the fin lodging itself firmly into his brain. I still have a copy of his CORD scan, which, for the medically inclined, showed the tract where seawater had gotten so far that it was about 2 millimeters from entering his ventricles. I reviewed him weekly for a few weeks while he was getting long-term 4th antibiotics and a cocktail of antimicrobials to cover the nastiness of seawater directly entering his brain, and to check on his plastic surgery wound healing, which was incredible, with his face totally realigned and together, only a 10 centimeter scar He lost most of the vision in that eye, but was otherwise completely fine. No cognitive deficits, no balance issues, no difficulty with speech, or moving the rest of his body, able to play basketball and everything. Resilience of the youth. Also, I will now never be able to bring myself to try surfing. The second one who came in was a guy in his 40s or 50s who had a litany of health issues, including some sort of vasculitis and a subcutaneous T-cell lymphoma, a kind of cancer under the skin that was eating away at his skin, for which he refused to have chemo, accepting only Chinese medicine. Incidentally, he was completely white Macedonian, and I'm Chinese by blood, so some interesting discussions trying to convince him to have further treatments. His leg was practically gangrenous, looking like a tabletop map of a DD campaign covered in forest and toxic swamps or something. He eventually did accept chemo, which instantly improved his skin, though he attributed the improvement to some antibiotics we gave him once, which absolutely were not what fixed him. Anyway, the thing that made me wonder how he was alive actually wasn't related to any of that. Amongst his many dermatological/vasculitic issues, he also had growths around his eyes and reduced vision. I tested his vision, and he was 6/60-2 in both eyes for non-medicos. That means that to see what the normal population can see from 60 meters away, he would have to be 6 meters away to see, and even then he was getting a couple of letters wrong on the Snellen letter chart. He had driven himself and his wife in, and when I asked how, he said that he doesn't really use his sight to drive, but rather that he senses the cars around him, as well as poles or headlights. Took me about an hour to convince him as to why he was not going to be allowed to drive for the time being, and a few panicked calls to the driving authorities. TLDR, young guy gets surfboard fin lodged into his brain, almost fully recovers. Older guy insists he can drive by sensing traffic, with vision worse than being legally blind. Was on general medicine wards as a second-year internal medicine resident. I had just come on the service for the week, taking over for a coworker. She warned me about this one guy we will call Jack. Well, Jack has a really bad cocaine problem that had taken a toll on his heart over the years, and had multiple admissions for severe, end-stage heart failure. Jack looked like one of the Doobie Brothers. He was not a heart transplant candidate because 1, he was so sick, and 2, he was actively using drugs. My co-worker told me that this was likely Jack's last admission to the hospital, as a few days prior he had slipped into a non-coherent state and was found on lab work to have evidence of multi-organ failure, liver, kidney, on top of his terrible heart failure. He stopped eating and was placed on tube feedings through a tube in his nose. He became totally unresponsive, and after long talks with his family, 3 adult brothers, the team decided to transition to DNR and subsequently total comfort care. My coworker told me he was expected to pass any day. Fast forward about 2 to 3 days. I'm on morning rounds looking up daily labs and waiting for my internship. He approached me saying Jack is awake, and he says he is hungry. I start chuckling, as obviously this is not possible, given what I mentioned above as well as labs from the day before showing that he had essentially non-functioning kidneys and his liver failure had progressed to the point that no normal human could return from. Google hepatic encephalopathy. I walk into his room, and sure enough, Jack is sitting on the side of the bed, yelling at me, asking why he doesn't have a breakfast tray. I was in absolute shock, as this man should not have been able to open his eyes, much less have a conversation with me, but figured crazier things have happened, and so attempted to chat with him. Did not get far. He really wanted breakfast, and told him I would call his family to let them know he was awake. I go back into the workroom after rounds to gather my thoughts before calling Jack's brothers. Only plan is to tell them that, while Jack woke up, I do not think this will ultimately change his medical course, and that he will likely get worse again, and pass within the week. He was just too far gone. Fast forward about an hour, still haven't called family. I was working on some other things, and I get a page from Jack's nurse stating call now repatient room 306. Typical page, probably something not too serious, as these pages are usually overhyped. I'm expecting someone with chest pain, shortness of breath, etc. Then I remembered that this was Jack's room. I also noticed that the nurse listed her cell number as the callback number. I call, and the following ensues. Doctor, it's nurse name. I can't catch him. Me, can't catch who? You sound like you're outside. Why are you so out of breath? Doctor, he is just so fast. Jack. He is so fast. I can't catch him. I called the police. I am on Cherry Street. Well, at this point I'm not really sure what to say. I'm gathering that somehow Jack has left the hospital, as Cherry Street is about 3 blocks away from the main hospital entrance. I confirm this with the nurse and tell her that there must be some mistake, as Jack was critically ill with multi-organ failure and in no capacity would be able to get 3 blocks away with his degree of heart dysfunction, massively fluid overloaded and swollen, heart pumping function at 15%, lungs full of fluid. Well, turns out Jack was a superhuman. Hospital police confirm that Jack had left his room in search of breakfast, walked down 3 flights of stairs, and essentially ran out the front doors of the hospital, escaping both his nurse and the hospital police. Again, let me remind you that this is someone who was on death's door, and if he wasn't made, comfort care would have been transferred to the ICU for likely intubation, dialysis, and 4th medications to make the heart pump better. This is totally insane. Point. The cops finally get to Jack, and he is refusing to come back to the hospital. Given that he didn't actually break any law, the cops ask me what we should do. I have no clue, and if we should restrain him to bring him back. Given the complexity of the situation, I involve the ethics team at the hospital and we decide, after talking to his family, that we will let Jack do what he wants to do. He seemed to have capacity to make this decision. He says he is not coming back, and that was that. The miracle that is Jack. Point. I saw Jack a few more times over the next 1 to 2 years, actually doing decently well, save a few admissions for minor heart attacks with cocaine use. He eventually decided himself around 2018 that he didn't want to fight anymore. At that point was on multiple 4th infusions in the ICU, had a mechanical device through his leg helping his heart beat, and wanted to again go comfort care. We took all of his 4th medications down, and after a true to form Jack rally, where his blood pressure markedly improved, he finally passed. He was a true all-star that no one ever thought would make it that far. What a guy. Not a doctor, but was there when my uncle was nearly dead. He was in his 50s at the time, and got spinal meningitis. He was a 2-pack a day smoker, which certainly didn't help the situation. He was in a normal hospital room, and had a runny nose that wouldn't quit, and an extremely bad headache. Turns out he was leaking spinal fluid out of his nose. By the time we made it to the hospital, they had rushed him to surgery. We were sat down by a few people, I don't recall who. I was only 14 or 15 at the time. We were told to prepare for the worst. They said they'd not encountered someone surviving this, and were going to try some sort of mesh they'd not used before. He came through surgery, but was an ICU on a vent, listed in grave condition. We were told to say our goodbyes. My aunt was a complete wreck, understandably. He was like that for 2 days, and then, miraculously, the mesh had worked. He made a full recovery. He's also now had bladder and colon cancer, survived those too. He's almost 80 now. Oh, and he quit smoking. 10 years after the meningitis. Not a doctor, but rather a patient. I had a liver transplant due to end-stage cirrhosis. 30 years of taking meds for a very mild form of epilepsy basically ate my liver. I was admitted to trauma ICU due to infected ascites and edema. The bile ducts had been eaten off my liver, so I also had that poison running through my body and a host of other liver disease issues. I had the first surgery, died twice on the table, and was told it took 5 to 8 minutes to bring me back each time. Bled out and needed 125 units of blood put in me, then put into a coma, with the new liver stuck under my skin to keep it warm. The first surgery lasted 11 hours and my family was told to start looking at funeral arrangements as I had so many complications. The surgeons didn't expect me to come out of it alive. A week later, the bleeding was finally under control, and they went in and spent 6 hours hooking up my new liver, but due to there being a week-long gap between surgeries, it was very sluggish to start working, so they were actively looking for another liver. My blood pressure was dangerously low, due to all the transfusions. Again, my family was told to look into funeral arrangements as the surgeons weren't sure they could find another liver, and I was having so many problems with the blood pressure being so low. The liver finally started working properly about 3 days after the second surgery, but still had low blood pressure issues, so I was on a buttload of meds of all kinds, including several to get my BP back up to where it should be. My doctors called me a medical miracle as they had never had a patient with as many complications as I had, and between the two surgeons, they had over 50 years of transplant experience, and said I was the most difficult transplant they had ever performed. Finally, after a month in the hospital, I was moved to the physical therapy ward, where I coded for the third time. The crash team was ready to declare me dead when my surgeon happened to be coming to check on me and finally brought me back again. I ended up spending 2 months in the hospital, and if I had different surgeons, I likely would not be here today, but they invested so much time and effort into keeping me alive that they weren't gonna let me die under any circumstances that they could control. There's pics on my profile if anyone is interested. I'm the patient, not the doctor. Cyclist struck by a 5-ton truck, knocked me off my bike, pinned and dragged me under its front passenger wheel for a number of feet. Double pneumothorax, diffuse axonal injury, broken hip, 5 ribs, and L2, L3, L4, L5, 70% of my torso 2nd and 3rd degree burns, road rash, to a point that my belly had a hole punched through the epidermis and fascia. Enclosed muscle avulsion that started at the midline buttocks, took my glute and leg muscles down to the knee, and wrapped around my hip into the front core/pelvic muscles. I had gone blind during the accident, but was conscious and calm the entire time. Once the ambulance arrived, I was cracking shitty jokes with them. Nervous reaction? The paramedic lost his mind after pricking my fingers and toes, and after confirming sensation, he said, "I can see your spine, and not only can you feel, you're cracking jokes." I passed out after that point, died on the operating table, was resuscitated, extubated in 2 days. They waited for my kidneys to crash, causing multi-organ failure. Didn't happen. No cognitive loss due to brain injury. Muscles were successfully reattached in my leg, and I was relearning to walk in 2 weeks. 3 days after my accident, another cyclist was struck. He died. My favorite trauma resident came into my room during a routine bandage change for my burns and helped the nurse. Totally unnecessary. He had just come from trying to save the other cyclist that died. I'll never forget watching his face while he helped the nurse. I realized that he was there to remind himself, sometimes you lose them, but sometimes you save them. I was incredibly lucky to be alive. Man in his 70s has been found lying on the floor at home. In the ambulance on the way in, he suffers a cardiac arrest, but the ambulance staff manage to bring him back, so when we receive him at the ER he's got a pulse, and his breathing point still unconscious though, and the pulse is very irregular. We start him on external pacing, which is basically using a defibrillator to jolt the heart frequently to maintain a normal pulse. Exam leads us to believe he's had a stroke, so we take him to court to see if he's got an intracranial bleed. Court is perfectly normal. As we get to the ICU he arrests again, so we start CPR again and go at it for several cycles, but it doesn't work, and then we decide that there's nothing else we can do, so we stop. I'm talking things through with the intensivist, who's been helping with intubation and arterial line etc. about what could have caused this, because we don't have a clear diagnosis. As I say, I guess we'll have to do an autopsy. I see 1 heartbeat on the ECG monitor. This is after several minutes of a systole, and almost a minute after we stopped CPR. Then there's another heartbeat, and another, and suddenly he's got a better pulse than he's had since he got to the hospital, and he breathes on his own. Me and the intensivist look at each other and go, let's wait with the autopsy. He doesn't seem to want one yet. Eventually, the patient wakes up and is moved to a normal ward. He never gets his memory back, anoxic brain injury, and unfortunately dies of pneumonia a month later. But until then I literally thought to myself, how the fuck are you even alive? I was in a patient's car crash, oversteered a corner and hit the tree doing like 40. My body naturally passed out before I even hit the tree. I woke up, glass in my mouth, but I was okay. I checked myself, felt fine. Nothing hurt. I slowly crawled out and walked on the road. I looked around. No one saw the crash. I walked back to the car, found my phone, and called my parents. They called an ambulance and police, and picked me up. Once I said I have a headache to the cop. When he asked about everything, the medics slammed me onto a stretcher, and were freaking the fuck out, hurrying me to the trauma center, and getting me a knife. And I'm just laying there thinking I shouldn't have said that. They did a cord scan, and got my white blood cell count. White blood cell count was perfectly normal. I just had a headache cause I'm assuming I hit my head either off the B-pillar or the wheel. Either way, everyone was wondering how I walked away from that unscathed and feeling mostly fine other than a headache. They were mainly worried I had a concussion or brain bleeding. But nope, the car saved my life. Okay, so one of my favorites was from last year. Guy is a 60-something-year-old who lives in a trailer and is a terribly uncontrolled diabetic. Obviously he's had some circumstances in life that have been unkind to him. His blood sugars regularly run between 600 and 700. Needless to say, blood with those sugar levels is probably sweeter than average. So this guy made the terrible mistake of sleeping in his recliner in the living room of his trailer one night. He awakened several hours later to find 4 rats nibbling off several of his toes. There was a lot of blood. He was rushed to the hospital, where he was given antibiotics and his toe amputations were formalized. Gross, 4 months later the same guy comes back to the hospital because, you guessed it, he fell asleep in his recliner again. Apparently his son was walking through the living room at a late hour and saw rodents scurrying away from the Lazette boy. He exclaimed, direct quote, "Pa, the rats are back," and yet again they rushed to the hospital to get more ABX and surgery. Thankfully the rest of him made it through the encounter more or less unscathed. TLDR at King says looks like meat's back on the menu. Been taking care of Rona patients recently. So some quick info. Normal oxygen saturation is 100%, but anything above 87% is considered acceptable in someone with lung disease, or above 89% without lung disease. Anything below is not compatible with life, especially once you get to like 80%. People are typically completely out of /loopy that low. Had a sweet demented patient a couple of days ago whose DNR/DNI should probably be comfort measures. If she was full code she'd 100% be tubed, so on non-stop CPAP, not a ventilator, but pushes oxygen into your lungs, saturating in the high 80s, but wanted to eat, and we were like sure she's not long for the world. Anyway, let her eat. So we switched her to Evo, a fancy breathing machine, at 40 liters of CO2. To put it into context, that's like breathing 100% oxygen that's almost being forced into your lungs, and she ate her food, while saturating in the low 70s looking completely comfortable. Oh, and normal sodium is 135 to 145, and typically when someone's sodium is 146 they experience extreme thirst, and above 149 basically all you can do functionally is look for whatever to chug. Her sodium was 159. We were correcting it slowly, this entire time. Just chilling, eating her mushy food, smiling at us with oxygen and sodium not compatible with life point sheet. None of that makes sense to regular people, does it? But I promise, it's weird as shit. Normally when someone has an O2 saturation of 70% they look like they are knocked out, obtunded. When someone has a sodium above even 148 they are a weird loopy mess. Not a doctor, but I got called in for a trauma surgery one night. Story was that this guy was having a Bible study group at his house, but his friends and relatives were outside drinking. The guy stopped drinking and became sober, and found God. Anyway, his friends were drunk, and barged into his Bible study, and made fun of him. It pissed him off so badly, that he took a large kitchen knife, and stabbed one guy to death, and jammed the kitchen knife so deeply into the left eye socket of the other guy, that the damn knife handle broke off and became stuck. I get called in to help surgically remove the kitchen knife. It was like being in Camelot with the sword in the stone for the surgical team. 2 huge burly guys couldn't pry the knife out. Thankfully, with enough force and concerted effort, our surgeon was able to remove the knife. The crazy part? The guy walked into the ER awake and alert. The other crazy part? It was the day before Halloween, so the next day after surgery he had an eye patch. We sent him home, because other than losing his eye, dude was totally fine. Dude was a pirate for Halloween. Happened several years ago, not to a doctor, but I will always remember the doctor's reaction point. I was in a car accident. I woke up in a hospital bed and was told the neurologist wanted to speak to me. Scared me shitless. So many bones broken. I was strapped to the bed and wasn't able to even move the bed to help me sit. Had to be laid flat. Pelvis broke in 3 places. Multiple ribs, leg, arm, collar, discs on my back out of place, head injuries which required a ton of stitches, and the list goes on. Neurologist runs to my bedside, looks at me, and explains I'm a neurologist. My whole life I've been involved in the pursuit of science. When I had you in the emergency room, I understood what was meant by a belief in the supernatural. People don't wake up from your injuries. Your brain function is 100%. I backquote stitched up heads with lesser injuries, where the person is left as a vegetable. Whatever happened to you is extraordinary. I wouldn't have believed it if I hadn't seen it. I'm still friends with this doctor. He's a really amazing guy. I attended his wedding 2 years later on crutches. Just for context, I was unable to walk for 8 months. Took a hell of a lot of physio and work from an amazing team of healthcare professionals, but I'm now back to perfect health. I developed type 1 diabetes when I was around 5, best guess, but wasn't diagnosed until I was 10. I was always a skinny kid and quite secretive, so the coping behavior I had adopted was well hidden. I used to drink around 6 L of water a day to cope with the dehydration, and I was good at hiding the food that I couldn't eat. It was the bedwetting that eventually got me caught, because I was found on several occasions running the washing machine or changing my sheets in the middle of the night. My parents thought I had some kind of bedwetting problem and they couldn't fix it. My parents were very good and responsible people, but I was super evasive, so they took me to the doctors for some further advice. The doctor was nice and asked all the usual questions to get to the root of the problem, and then decided to take some blood to check for any obvious conditions and sent us on our way. A few days later we got a panicked call from the doctor saying that he'd dispatched an ambulance to take me to hospital immediately because he couldn't believe what he was reading on the blood tests and that I needed immediate care. Turns out that my kidneys and liver were on the verge of failure, and even the attending doctor had to have the test results confirmed several times because I simply didn't look like I was as close to death as I was. I don't remember the long list of things that were drastically wrong as it was over 20 years ago, but I remember I was in hospital for about 6 months having dialysis and taking a whole variety of medicines and treatments. They discussed surgery and transplants, and I remember overhearing them telling my parents that I had a low chance of surviving, and if I did there would be long-term consequences. I never really felt all that unwell, just ravenously thirsty all the time and a fair bit of throwing up. My diabetic specialist used to call me Wolverine because I had thick, mid-length hair, an attitude, and my physical recovery was bordering on miraculous. I was back in frequently for checkups, but my organs showed no signs of long-term damage, and I was free to continue living my life. I was a patient, not the doctor, but I was told it was shocking I was alive. Started getting stomach pain at age 12. Family doctor decided it was cramps and did 0 tests. This continued for years. I would often vomit or struggle to walk due to pain. My parents trusted that doctor and wouldn't take me to another one. Just after I turned 18 I went to get a second opinion on my own. It was a tumor, and since it had been allowed to grow unchecked for 6 years it weighed 3 pounds. It was not cancer, it was a cystic tumor, and it was full of septic blood. Basically, I'd been walking around with a water balloon full of poison in my guts. If it had ruptured, I'd have died. Somehow, it stayed intact. On top of that, it was crushing my organs, since it was so big. They said I might lose too much of my bladder and need a bag attached to me on the outside. I was also told that not getting enough blood can lead to organ death, and I was lucky to have missed that as well. TLDR. Big fragile tumor full of poison, also crushing my organs for 6 years. Didn't die. I'm a doctor, but in this story I'm the patient. When I was about 12, I had an abrupt onset nosebleed due to a medical issue in my nasopharynx. And I'm not talking your run-of-the-mill nosebleed with the dripping blood. This was like someone turned a tap in my nose that was hooked to a major vein to fully open, because I had blood pouring out of my nose so rapidly it was just a solid 1/4 inch wide stream of blood that, if I tried pinching my nose or tilting my head back, it literally started drowning me in my own blood. Obviously it was a medical emergency and my parents loaded me up in the car and hauled, but to the closest while I held a bucket in my lap and tried my best to control the bleeding while dad was doing 100 miles per hour down the highway. Naturally with that volume of blood, I swallowed a fair amount incidentally and learned an interesting lesson in how blood will quickly dilute into your stomach contents / juices and make you very nauseous and cause you to start vomiting up large volumes of now blood red puke, which over course went into the bucket along with all the other bodily fluids pouring out of me. So by the time we arrived at the I had this bucket, one of those plastic gallon ice cream containers, practically full of what appeared to be blood in my arms as I walked through the entrance. It all happened pretty quick at that point as I had lost so much blood I was turning pale and starting to see stars that precede passing out from hypotensive shock, and at the same time the doctor, mom was a nurse at that same hospital and had called ahead to tell them we were coming, had met us near the entrance, and when he saw me come in looking haggard as can be with what appeared to be a gallon-sized bucket of blood and a lot of vomit in my arms, he said something to the effect of how the $? Ash are you even alive, before I hit the floor and everything went black. For reference, the average adult has 9 to 12 pints of blood in their body, and losing around 1/2 to 2/3 of that can be lethal, and I was a fairly diminutive 12-year-old, so this poor doctor had to think he was looking at someone holding what appeared to be a lethal amount. 1 gallon equals 8 pints of their own blood in a literal blood bucket. Luckily, after some emergency cauterization and packing, a very long trip to a hospital whose name sounds like a sandwich spread, and a series of surgeries, I pulled through without any residual issues, minus some major facial scarring, but that's more of a subjective issue I suppose. As I now am a physician myself, I have shared the story with quite a few of my colleagues and a fair number of them have even told me the exact thing you asked in your original question. Cheers. Was the patient on this one point. When I was 19 I began having a horrible headache, like migraine plus horrible, for weeks. Kept going to my GP and getting this or that pain medication but nothing was helping. Got bad, I was hearing things, having hallucinations, etc. Finally came due for an eye exam, and as soon as he did the slit scope, he asked who my GP was. My GP and eye doctor are in the same building, so he left to speak to the GP. He came back and said I needed to go to my GP straight from his office. Apparently, he discovered I had papilledema, pressure on the optic nerve, meaning increased intracranial pressure. GP spoke to me, explained what the eye doctor had found, and told my dad to drive me straight to the hospital and he'd meet us there. Not the he would have a bed arranged. We got there, and I'm thrown into full plague dress, mask, gown, all of it, and escorted to a room in the old wing of the hospital that they really didn't use anymore for patients, like, hadn't been updated since the 80s kind of rooms. I'm told I'm under quarantine and the only person allowed in was my dad. Since we already lived together he was no risk of further exposure. Anyone else had to be in full mask / gown / etc to enter. I'm not in the room 5 minutes before my GP shows up and explains I likely have one of two things, but they are taking me for a lumbar puncture, spinal tap, to verify which. I got wheeled off to the radiology depot for the tap and brought back. Apparently my CSF fluid pressure was about 4-5x normal. The doctor performing it said he'd never seen it shoot that far before. When he made the puncture, sample got sent down to the lab which confirmed that for going on 3 months I'd had bacterial meningitis. If you know anything about meningitis, bacterial is the one that's got a 20-30% mortality rate, and most people definitely don't have it. For nearly 3 months I got moved into a full quarantine room on the neuro floor with antibiotics and other shit every couple of hours for 3 days. Finally they cleared me to return home with more oral antibiotics for a couple weeks. On a side note, Despite the labs showing BM, the consulting neurologist refused to believe it and ordered several more tests including 4 different MRIs and 2 more spinal taps. She finally gave in. I was on my first rotation as a junior doctor on a medicine for the elderly ward. We were halfway through our morning ward round and a patient gets wheeled into one of the side rooms we had already gone past. We quickly got a handover and were informed she was taking a side room for end of life care and the family were informed. We looked at her notes and saw she had metastatic cancer, can't remember primary, and had metastatic lesions eroding through her skull completely with air, seen on the CT scan in the cavity. This elderly woman was unresponsive, and we checked her observations and made sure she was comfortable before moving on. The following morning we were doing the ward round again, and this woman was still alive. She had not deteriorated in any way. Again we checked her observations and made sure she was not in any pain or distress and moved on. This continued for 2 more days until she gradually became more responsive. We started to decrease the sedative meds, and as she started to become more conscious we restarted some of her regular meds. I still remember on the next morning walking past her room with her just sitting up at the edge of the bed asking for food and something to drink. After checking her bloods and making sure her swallow was safe we happily obliged. She continued to improve and was walking by the following week. We managed to move her out to one of the bays where she was chatting happily to all of the other patients and was probably the most lively patient there. Unfortunately I changed rotation before we got her home, however plans were being made for social care and she was doing fantastically. I will never forget her and the strength she had to bring it back from the brink of death. I was on a respiratory ward for placement and there were 2 guys opposite each other. My consultant is a keen believer in DNA CPRs for people with end-stage conditions to reduce their suffering. One gentleman had an exacerbation of pulmonary fibrosis and was in his 80s, but he was as fit as you like and was still mobilizing about. The consultant said not to bother with his DNA CPR as he would probably be out in a few days. The guy opposite was in his 60s. He had a cerebral stroke so could not do anything himself and was constantly shaking. He could speak or swallow properly and he was in with a CAP, community acquired pneumonia. He had tried violently committing suicide not long ago and you could see in his eyes he had just simply given up. He was like a skeleton and was pale and barely breathing, in and out of consciousness. His kidneys had basically packed in and his creatinine was going up and up every day. They were giving him pain meds to let him go peacefully. That was on Thursday. Friday morning things looked the same. Pulmonary fibrosis guy was packing his bags as he was due to be discharged and was looking very well. Cerebral stroke guy's bloods were getting worse and he was spending most of his time unconscious. Then in the afternoon pulmonary fibrosis guy had an NSTEMI and went downhill really fast. I went home for the weekend and when I came back in on Monday pulmonary fibrosis guy was on his way out. He could hardly breathe and they had moved him into a side room for his family to be with him. He died that afternoon. On the other hand, the cerebral stroke guy was sitting up in bed as much as he could and I think he was smiling a bit. His kidneys had been getting better over the weekend. His appetite had come back. His chest x-ray showed less consolidation. He was properly on the mend. By Friday cerebral stroke guy was discharged. I can't believe he pulled through on a ward like respiratory where the death rate is high, with everything going on with him, and with his bloods getting worse and worse he naturally just turned it around. I couldn't believe that in a week someone looking like a quick in and out job was dead and someone who looked like a controlled, dignified death was discharged. I learnt a very important lesson that day, which was to always expect surprises from patients. My father was a walking catastrophe. Physically imposing, but between the heavy alcohol and the occasional cocaine, he was a mess internally. This and his love of the nightlife culminated in him getting a tire run across the face in a parking lot after a bar incident. 18 units of blood, coma for 2 weeks, death back S door, etc. Somehow recovers, gets diagnosed with Hep C prior to modern treatments, and is told he has 5 to 10 years to live if he gets sober and longer if he can qualify for a transplant. Go somehow further off the rails, right into a big ol' crack cocaine habit. He ends up back in the hospital more than a few times. Esophagus bleeds, liver issues, the time he got hit by a plow truck with a .39 back, etc. Fast forward 15 years later. My dad has been sustaining his life and drug habit on a government check and whatever scams he's running on the side. My aunt is going through chemotherapy. I'm with her and my other aunt at the hospital, and we see my father's original doctor. My aunt makes conversation before she says, well, we have to go pick up Dad's name. The doctor turns white as a ghost and stammers out, Dad's name? He's still alive. How is he still alive? He was so caught off guard he actually apologized after given 5 years to live in 1993, finally checked out from completely unrelated cancer in 2013. Every doctor who had him as a patient called him a walking medical marvel. I sure hope those genes carry. Not a doctor or a nurse, but I used to work at a health insurance company, doing hospice care discharge. I would have to call the hospice provider and ask what the expiration date of the patient was after 6 months. If you didn't know, you only go on hospice if you have less than 6 months to live. I would usually wait longer to call because I didn't want to have the person still be alive. So I made a provider call for a stage 4 liver cancer patient who chose to stay at home for hospice. It's 5 months, so I think I'm safe because I've personally never had a hospice stage 4 liver cancer patient make it past 3/4 months. So I call the hospice care company and they patch me through to the hospice nurse at his house because they will have to explain this. Great. She answers and tells me, yeah, he's still alive. In the background I hear, of course I'm still alive, I keep telling you people it's not my time. RN proceeds to tell me he told her the first month it wasn't his time yet and he's not going anywhere. The second month rolls around and he doesn't seem to be getting any worse. The third month comes and he seems to actually be getting better. The fourth month he even looks better and is eating normally and playing poker all day. She calls the doc. He swings by on his way home, Long Island, and examines him. He sends him for an MRI. Tumor had shrunk over 50% with no treatment. She says she's glad I called because they don't know how to discharge me from hospice. Who the hell gets discharged from hospice care? I had to get it involved to unflag this case as this had never happened before. Ending of the story. His tumor shrank to a scar. He got discharged from hospice and was still alive 6 years later, which was the last I checked on him. I work in a pathology lab on the admin side, so I don't often see patients IRL, but one night I was phoning out abnormal results and I saw a troponin 70,000. A troponin 40 means the patient had a heart attack and needs urgent attention. 700 is extremely high. 70,000 was unheard of to most people at work. After I contacted the patient's doctor, I went for a smoke and saw one of the scientists and told him about it, and he flat out denied it as almost impossible. Right then another chemical scientist walked out talking about it and confirmed that the patient had 2 SSGs, blood tubes, and then ran each tube twice on separate machines to rule out machine error or sample contamination. The result was legit. The patient had a follow-up set of bloods a few weeks later with a troponin like that. I'm surprised the patient lived long enough to see the result. A few hours, let alone start recovering and have a follow-up weeks later. Not a doctor, current med student who worked in outpatient cancer/blood center. There's a condition called idiopathic thrombocytopenic purpura, known as ITP, where your body just decides to start killing off your platelets, which are important for blood clotting when you bleed. Normal levels are around 150, 400k. One of the patients that sticks out to me was the one whose platelet count, despite rounds of steroids, IVIG, and even splenectomy, always hovered around 7, 9k. He would ski without a bike helmet. Believe it or not, I also saw a patient who had this condition who presented to the ER with a whopping platelet count of 0. Eventually drugs made it go up to a safer level, but during the workup everyone was worried that it was going to be some sort of cancer. Nope, just a weird inflammatory lung disease that's, fortunately, very treatable. But damn, he was lucky to make it out of the hospital without a huge brain bleed without any platelets. Nurse, not a doctor, but we had a patient in the ICU with COVID. He was fully intubated, on a filter as his fluid balance was roughly plus 5,000 after a few days, meaning 5,000 ml of fluid was being stored inside the body and not being expelled. On this particular Friday, after being reviewed by a consultant, we had determined he was more or less going to die within a few hours as his blood pressure kept dropping to 40/30, then increasing. As a final attempt, we had pronounced the patient, which can have a spontaneous effect as it tends to clear particular sectors within the lung of fluid. This seemed to have saved his life as his oxygen saturation never dipped below 94. His blood pressure was consistent at approximately 110/60. He made it alive as I ended my shift 4 days later to arrive on ICU, and he's partially awake. Upon speaking to the nurse, she stated that he is recovering very well, and they are looking to wake him up and transfer him to a non-intensive care ward, all while being so certain he was going to pass away. Not a doctor, but a former medical scribe. I went into a room with my doc to see a patient who was a homeless gentleman in his early 60s. The first thing that I noticed when we walked in the room was that it looked like he was smuggling a basketball under his shirt. He was there because he had twisted his ankle a few days prior and thought he had broken something and wanted to get it checked out. During the physical examination, the doctor had the patient lift up his shirt and there was a basketball-sized lump poking out of the patient's stomach. The doctor asked him what it was, and he said it had been there for years and he can push it back in for a little bit but it always comes back out. Turns out that the lump was the patient's actual intestines poking through a giant abdominal hernia. The patient refused to have any treatment and to have his intestines put back inside of him, and demonstrated how he could push them back in and hold them in if he flexed his stomach. The patient's toxicology report showed positive readings for THC and crack cocaine. Shocker. Not a doctor, but a patient. When I was about 20 years old, I wasn't feeling very well, so I decided to try to rest and drink some OJ. I was also pretty thirsty, so I ended up drinking probably a gallon of OJ fairly quickly. Things deteriorated and finally my parents decided I looked pretty bad and took me to my family doctor. We got to the doctor and we explained the situation and he seemed to have an idea of what was up really quickly. He pulled out a glucose meter and tested my blood sugar. My sugar levels were high enough that his meter couldn't read it. He told us I had to go to the URSAP point. I remember when we got there and had the proper test done, and the nurse told us the results. She said she was surprised I was conscious at all, and that my blood sugar was well over 1000 mg/dl, or well over 55.5 mol/L. And that's how I found out I was a type 1 diabetic, the first in the family. I'm a 6 feet tall male and weighed 120 pounds from all the water weight I had lost. Things were bad enough that my eyeballs were swollen and I couldn't see clearly for quite a long time. I had to zoom my browser to 72-point font while wearing my glasses to make much of anything out. I'm not a doctor, but back when I was an EMTP we had a redneck dude who got drunk and tried to catch a rattlesnake with his bare hands. In his words, he had done it before and he wanted to make a hat. So he got bit on the finger and fell backwards and scraped his arm up. No big deal, right? We can deal with snake bites. A rattler bite isn't the end of the world. If he had bothered to call us, that is, his simple solution is to get sheet-faced instead, then down a bunch of aspirin and tough it out. Only problem? Alcohol is a blood thinner, aspirin is a blood thinner, and rattlesnake venom? It's a pretty strong anticoagulant. So a while after this dude gets bit, downs aspirin and gets sheet-faced, his bite wound starts to bleed. No big deal, right? Small punctures. The only problem is, it won't stop bleeding. Then, all the cuts he got falling down start to bleed. Just scrapes on this arm really. Only they won't stop bleeding either. His response is to cover all his open wounds with duct tape and band-aids, which immediately fail to do anything. Then everything else starts bleeding. When I say everything else, I don't mean cuts. I mean his eyes, his nose, underneath his fingernails, his orifices, all of them. And it won't stop. It just keeps bleeding, and he keeps drinking. Luckily, at some point a woman, I can only assume, was his sister wife, based on his actions and appearance, had the genius idea of calling us. By this point he is not only bleeding from literally everywhere, he is vomiting blood, probably because a lot of it is pooling in his stomach and making him sick. So we pick him up and take him to the ER. He was cracking stupid jokes and laughing the whole way, and they end up testing his blood platelet count and it's super faking low. Like really low. They ended up having to give him hemodialysis, and I'm pretty sure he lived. I don't know for sure cause I had to leave. He was faking stupid. It's me. Working as a chef during the height of wedding season, 70 plus hours a week, living off of shots of espresso and handfuls of Nurofen for the past decade. Was throwing up most mornings, but hey, I'm full of nothing and stressed out of my gourd. No biggie. I slice my fingertips off all the time. Finally woke up on my one day off in a month and could barely turn over in bed. Fumbled for my phone and had to call treble 9 3 times before the dispatcher could understand me. Slid down the stairs and opened the front door to wait for an ambulance and woke up 3 days later projectile vomiting a couple liters of blood as I was extubated by the doc who looked me dead in the eye and said, "Jesus, you are like a vampire who's allergic to blood." 2 centimeter plus burst pyloric ulcer, stomach contents leaked all over my guts, blood pressure apparently went haywire after they woke me up the first time, tossed my ass back under for another 36 hours, got pneumonia, 2 weeks in ICU, 3 total in hospital, 2 in a care facility and 25 kilos lost later. Finally went home and fully sans a stomach. I'm the cautionary whale of food service, and I thank Lord Bourdain every day for the faking amazing nurses of the NHS. My grandpa had been failing for a year and a half, and they had chalked it up to old age. He was diagnosed with heart failure, kidney failure, high blood pressure, diabetes, etc. and so all the doctors would just shrug and say there wasn't much to do. A week later, after the last doctor visit that I had been part of, my grandma couldn't wake him up. He was slouched on the couch and wasn't waking up or responding. Gram calls dad, she was in shock. Dad calls an ambulance. This all happened in 15 minutes. We got him to the hospital. He's still not responding. Brain waves are low. He isn't breathing on his own, and there's no sign of life. The doctors prepare us for death and say he's not going to survive. The pain stimuli test brought up no reactions, and he was in a coma at this point. We all are told to say our goodbyes. We have a big family and only 2-3 people can see him at a time. We haven't taken him off life support yet. I'm in the air telling him he needs to wake up, that I believe in him, that I need him back, when he faintly squeezes my hand. I'm a realist. I chalk it up to a body twitch or my imagination. Next thing, his eyes are rolling under his eyelids, and he's chewing on the intubation tube. Again I chalk it up to weird body spasms, cause the docs said he wasn't gonna make it, so they can't be wrong. He ended up opening his eyes 6 hours later. Ended up in the ICU for almost 3 months on a tube, until he was diagnosed with Guillain-Barré syndrome. It's an immune disorder that causes your cells to attack and eat away at your nerves. The pathway between his lungs and brains was shot, and he had stopped getting enough oxygen until one day his body just shut down. He spent almost 6 months in the hospital with lots of ups and downs, and is now home. He's weak and slow building back his energy, and has to live on a ventilator for the rest of his life, but he has no other problems besides a bit of diabetes and anxiety. No heart failure, no nothing. I'm so incredibly proud of him. He is the strongest man I know, besides my dad and brother, and I love him. P.S. He said he saw the light that day in the air, but he could hear voices telling him to wake up and come back, and to have strength. He chose that day to listen to the voices and tried his hardest to blink. Oh god, so many stories. I worked nights at a level 1 trauma for 7 years, so the first that comes to mind is this guy was working on a building. Apparently he fell from a significant height and was completely skewered by a piece of rubber that was embedded in a concrete pillar. They had to cut the rubber out of the pillar, which couldn't have felt good to the guy hanging on the rubber. It went in just about the crease of the bottom of his buttock and came out above his hip on the other side. The fact that he survived the fall is incredible, then surviving the skewering, then the trip to the hospital and very bloody procedure after it took 2 of us to pull the rubber out. It was sorta pinned in his pelvis. I literally had my foot on the bed, pulling the bar with all my might, with another person doing the same. It finally gives with a suction sounding sklurp. The resident helping me, a surgical technologist, and the surprisingly heavy Rebber all fell on the floor. It was quite a scene. Bit late to the party, but my friend and I had traveled to the US from the UK for a wedding in LA. We got there a few days early, so decided to go to Vegas and see Britney Spears. Had a hilarious road trip, an awesome night seeing Britney, decided to have a few drinks after. A few drinks became a lot of drinks. Ordered an Uber to go back to the hotel. My friend refused to get in, wanting to carry on dancing. Fine, I need my bed. Have fun. Wake up, still drunk, empty bed next to me. Not too worried. He probably hooked up. Check out of the hotel. Text my mate to stop being a hoe and meet me so we can brunch and go back to La Point. Waited a couple of hours. Get a phone call from a hospital. Do you know friend's name? Yes. Can you please come to the hospital immediately? I have never sobered up so fast in my life. I see him on the hospital bed and nearly vomit. He'd been run over by a 16-wheel truck. Head pulled one way, body the other. I will never ever forget what I saw that morning. Every medical professional I spoke to told me I should prepare for the worst. If he doesn't die, he will be a paraplegic for the rest of his life. 4 years, multiple surgeries, rehab, physio, and he is almost back to normal. He suffers from extreme nerve damage pain, which they currently have no cure for, but he's doing amazingly well. The doctor said that what saved him was actually the high levels of alcohol in his body. It dulled the pain of the accident. Crazy. Approximate 13-month-old child, deathly white, HbF2. Couldn't sit or crawl. Breastfed for 4 months. Had never been fed anything other than cow's milk since. Mum said she'd tried a couple of times, but she didn't want it. Post-blood transfusion nurses tried to feed her baby puree, but she wouldn't take it. Mum just kept saying to give her a bottle of milk. It's what she wants. Didn't understand that her child was slowly dying of anemia. They had an older daughter who had been fed and had developed normally. I think the second child got left behind in terms of effort rather than deliberate neglect. I've never seen anybody so devoid of color. Blue lips, white gums, white tongue. She was of Asian heritage, but she was absolutely translucent before the blood transfusion. Babies are seriously resilient. Edit. This was a few years ago. What was then HB1 would now be recorded as HB20 as we use different units now. Not a drive, but this is my dad's story. Also, he lived alone since mom died. I say heaven doesn't want him. Hell is afraid he'll take over. 1998. On his way to a tech school for his job. This was about an hour away and lasted MF. On Saturday I visited him and could tell something was wrong. A drooping face and lack of coordination on one side. I argue with him and finally get him to the hospital. He had a stroke Wednesday morning and continued to drive to the school the rest of the week. Flash forward a year. He is on the dock to his boat and has a seizure and collapses across the dock. 6' either way, and he's in the water. He's found and taken to the I get there and talk to the drive. I tell him about the stroke and say he only has some minor issues on the left side. Drive says they saw the stroke cord scan and based on the size of the stroke he shouldn't be able to move his left side. Well, now he is comatose in the ICU on a morphine drip. Neurologists say there is no brain activity, all the settings as high as they can go. We pull the plug and he is moved to a room to be transferred to hospice. The day he is to be transferred to hospice he wakes up and eventually makes a full recovery. Now lives with me at age 81. I think Alzheimer's is going to win this one eventually. Obligatory, not a doctor, but consulted with one. My dad was not responding one day at home from extremely high blood sugar, type I diabetic. Ambulance arrives and says that the situation is critical and they will be rushing him to the hospital. Several hours after he was rushed into the all the glucose meters available weren't able to read his blood sugar, and this was hours and hours after not eating or consuming anything. Fourths pumping meds the whole time. His heart began to fall into cardiac arrest and his kidneys began to fail, suffering from a terrible case of ketoacidosis. The doctor tells me that the situation is so out of control that he had to be admitted into the ICU. Blood sugar was still too high for glucose meters to read anything besides high 3 heart attacks and kidney failure in one day. A few hours later into the night, lab reports arrived back from analyzing his blood, because that was the only way to know his glucose level. It read at 1750 plus. Both the ICU doctors who were overseeing him and nurses said they hadn't seen that level of glucose shock in their entire careers. Endocrinologist said that he'd only read about the smell of his breath, fruity apparently from the extremely heightened blood sugar, in textbooks and never once experienced it himself, and this was coming from quite the older gentleman. I also met the doctor in the cafeteria below in the lobby, and she told me that she was shocked to see I was still there the following day, because she definitely sent him to the ICU expecting him to die that day. Still not sure what the fuck happened to him that day, because he has no recollection the day of or before. Not a doctor, but my brother did this to a doctor. When he was in college he was riding his bike to a midterm, and fell off his bike. He was not wearing his helmet, strike one, and the back of his head hit the edge of the curb when he fell, knocking him unconscious. He had a brutal concussion, and ended up going back to his dorm, and sleeping it off, strike 2. He didn't go to the doctor for it at all, strike 3, and only ended up going to a plastic surgeon 8 years later, because he had a half tennis ball sized lump / mass at the spot where he hit his head. Doctor did a scan, looked at the spot and then said, "Let me go get a colleague," and left the room. He came in 10 minutes later, and the new doctor with him said to my brother, "Well, you shouldn't be alive." He had an intracranial bleed, and the mass was blood and CSF leaking out of his skull. Yay, not good. Thankfully he is still with us, and he just has a mark in the back of his head where the surgery happened. Really messes up his part. Not a doctor, but a story about a guy I met at a party a couple years ago. He was a good friend of someone I grew up with who verified his story. The morning after the party we were in the hot tub and I noticed these massive scars on his chest, ribs, arm, back, neck etc. So I asked him what happened. This is the story as best as I can remember it. He was driving his truck along a mountain pass and hit black ice. His truck went over the side of the cliff, plummeted around 200 feet, smashing through trees. He was airlifted to a hospital, where they rushed him into surgery. He had a punctured lung, broken arm, collarbone, leg, ankle, multiple ribs, neck, fractured skull, massive internal bleeding, something to do with his liver and I think either a shattered disc or broken back. Hours of multiple surgeries later, and 3 days in a coma he woke up where the doctor told him that no one should have survived the accident, let alone the surgeries it took to fix his sheet. Had a patient who had an untreated genital hernia. 4 years. This man watched one of testicles get bigger and bigger and bigger, and said nothing to anyone. Well, by the time he was so seriously ill he could no longer walk, his testicle had swelled to the size of a basketball. Like for real, basketball. Turns out the hernia got so big it caused a hole that went up into his abdomen. His intestines were leaking down into the space that was his testicle, which is how it had gotten so large and had caused infection. He was super septic, blood pressure uncontrollable, oxygen saturation dangerously low, and had parts of his intestines in his nutsack. I was still awake and talking at the time I saw him. How he survived so long is still a mystery, as they were in there so long all his other organs had begun shifting as well. I'm not sure if he survived after this, but the man said it had been that large for well over a year. Me. A couple of years ago, I had carpal tunnel surgery and the physician gave me a prescription for 4 capsules of a powerful pain-killing drug. The bottle said to take 1 a day for pain. I filled the prescription and put the bottle in the cabinet. In that same cabinet I also had my amoxicillin tablets that I must take before any dental work due to my artificial knees. Since I wasn't in much pain I didn't take any of the painkiller. The day of my dental appointment I grabbed a bottle, took all 4 of the capsules, and went to the dentist. About an hour or so later I got real dizzy. In fact I couldn't even stand up. I complained to my wife and she went to the cabinet and was shocked to find that the 4 amoxicillin capsules were still in the bottle. She immediately called the doctor. When he heard what had happened he said, "You mean he is still alive?" She said yes. He said he will make it then, because he should have been dead an hour ago. Not a medical professional, but I do have one of these stories. One of my best friends of 15 years also moved in and out of my apartment 2 separate times within 3 weeks because of relationship issues. After moving back in with her for the second time and not hearing from him for over a week, I get a call from his father saying he's in the ICU and that he had tried to stab himself in the heart with a large fantasy dagger. Luckily he missed by less than a centimeter. This knife was huge. He was around 300 pounds when this happened, and it was still sticking several inches out of his back. The EMTs were stunned to see him sitting up completely and calmly coherent. Supposedly the surgeon still has the dagger because he was so completely perplexed as to how my friend was even alive. The surgeon was also not amused with the questioning joke of "Can't you just King Arthur that sheet out of my chest?" He's doing good now, and I recently this past year found out it was actually his girlfriend who stabbed him, and he didn't want her taken away from her life with an attempted murder charge, so he told everyone it was a suicide attempt. So I'm not a doctor, but I do have a very incredible story about my mom. About a year ago my mom was faked up on God knows what, has a pill problem, and has had it for years, and wrecked her brand new car on a highway in my old hometown. I think she had the car for a week. Later that day, she was feeling down that she wrecked her car and decided she was now going to get drunk about it. She walks across that same highway, mind you it's dead of winter, and grabs a case of beer and some vodka. Was still faked up on whatever she had took earlier, and started to walk back across this highway without even looking. She dodged 6 out of 7 cars coming, but the 7th car couldn't stop. That car nailed her going 50+ miles per hour and launched her. She bounced off the road over 150 feet from where she was hit. The only reason I know she bounced is because I heard about it from the local police in my hometown. They refused to show my brother, sister and I the traffic video. It caught the whole thing. She couldn't get airlifted to Chicago because a snowstorm was raging, so she had to get driven an hour and a half to O'Hare from northwest Indiana. She was conscious the entire way. Fast forward 48 hours, and I'm on the first plane up to Chicago because the injuries were extremely serious. She almost had both legs and hands amputated. She should not have been alive. I have a strong stomach, but seeing my mom laying on the bed flailing like a fish was so disturbing and made me vomit almost. List of injuries: broken C5, broken ribs, both legs shattered, broken wrist, dent in her skull, broken eye socket, spleen went up into her diaphragm, hip broken front and back. This is very hard to heal. Through all of that, she did not suffer any brain damage, and I flew up about 8 months later, and she was walking by herself and looked like she had never been hit by a car. I met the EMT at a bar during that initial flight up, and he said it was his first day on the job. He said that he couldn't believe my mom was still alive because everyone that arrived on scene pretty much chalked that one up as a death. All the doctors and rehabilitation staff that she has been through to this day still can't believe my mom recovered as quickly as she did. She's one tough faking cookie. Not as dramatic as some, but there were a few what the facts traded among my dad's doctors over this one. My father was getting his law school physical, aged 22, when the resident listening to his heart said, "Have you always had a murmur?" What murmur? Turns out my dad's heart was slipping in extra beats. Instead of thump 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 it was going thump thump thumpity thump. Scans showed that his mitral valve was partially non-functional, so blood was leaking backwards into his heart every time it tried to pump. The doctors were confused because usually, you're born with this condition, and my dad was already 22. How did his pediatrician not hear it? How was he still living a perfectly normal life? After some thorough history taking, a cardiologist eventually deduced that my dad had had misdiagnosed rheumatic fever in high school. He'd run a fever and been sick and itchy for weeks, but his family doc thought it was just the flu. So he survived rheumatic fever without any antibiotics, which in itself is unusual. It had damaged his heart, and somehow nobody noticed until 5 years later. This was the late 1970s, and they told my dad he'd need a valve transplant before he was 50. But somehow, he actually started to heal on his own, plus they invented medication treatments. And now he's 62 and still able to exercise normally. Practically the only long-term effect was that he obsessively asked our pediatricians to check for strep anytime we were sick. and listened to our hearts after every fever we ever ran. When my dad was 18, he was driving with his buddy and flipped the car several times on a back road. A volunteer firefighter lived really close and heard it, so he came running over and helped my dad's friend out of the car, assessed my dad while they waited for the ambulance, and told his friend that he was dead. The firefighter couldn't get him out of the car since he didn't know what kind of injuries he had, so he couldn't start CPR. He was VSA when the paramedics got there, and it took a while to get him out of the car. Once they started CPR, he got a pulse for a few minutes, then VSA again. He kept crashing periodically during the ambulance ride. When they got to the hospital, they realized he had bilateral pneumothorax, a crushed pelvis, fractured vertebrae. Most ribs were fractured, but hard to say which were from the crash and which were from CPR. They told my grandparents to say their goodbyes. Once they dealt with the pneumothorax, they were able to resusc him and deal with the rest of his injuries. He needed a couple surgeries, including extracting the teeth that had gotten impacted in his sinuses from hitting his face on the steering wheel. Everyone said he shouldn't have made it. Now that I'm in nursing school, I don't get how he survived either. No brain damage whatsoever despite several minutes without oxygen, which makes no sense to me. The only long-term effects are chronic back pain and stiffness, and recurrent sinus infections. All things considered, an excellent outcome. My grandmother woke up in the middle of the night, out of a dead sleep, for reasons unknown. She still to this day has no idea why. She looked over to her husband and realized he was laying there, and his breathing was very weird. When he wouldn't wake up or respond to her, she called 911. It was storming that night. Ambulance arrives, takes him to the a doctor on call. It's about 11 PM or so. Eventually figures out something is up with his heart, and he is pouring blood into his abdomen. They had no one on staff capable of doing the emergency surgery needed. Grandpa needs to go to a far better hospital about 15 miles away, but they can't life flight him due to the storm. They get him in an ambulance. About this time, grandmother calls my mother because the doctor had come and told her that realistically, grandpa might not even make it to the other hospital. Mother needs to get down to Philly now. Problem: mother is 3.5 hours away. Mother throws herself in the car, leaving her husband with the 3 kids, and starts driving in the dead of night. My aunt drives to meet the ambulance and my grandmother at the other hospital. Grandpa is still alive. When they reach the other hospital, he goes into surgery and stays there for a long time. At some point in all of this, I missed several phone calls from my mother because my phone is on silent. I now have a paranoia about sleeping with my phone on silent. He comes out of surgery well into the morning. He had a rupture of the aorta, and the heart surgeon that saved his life says that he honestly has no idea how my grandfather lived long enough to get to the hospital, that it's an honest to goodness miracle. They drained an obscene amount of blood out of his chest and abdomen, got his aorta patched up, got a lot of donated blood into him. Then it became a waiting game. A 10-day waiting game while my grandpa was in a coma. To everyone's shock, including his doctors, when my grandpa came out of the coma, he was absolutely fine. Not only that, but he had no recollection of anything that happened, and actually thought they were joking with him when they told him everything that happened. It all led to him going cold turkey after a 60+ year heavy smoking habit, and he lost a lot of weight. He's still kicking, amazingly. Not doing great, but still alive. It's been about 7 years now since all of that happened. I'm not a doctor myself, but my grandfather is such a patient. Just after his 80th birthday he was rushed to hospital again, but he was constantly passing out and found to have a very dangerously low oxygen level. In the hospital it later turned out that he had pneumonia and COPD. This together with his low oxygen level was already extremely worrying, but he made it through the night. 2 days later, however, we were called that it now seemed to be the end, and if we wanted to see him one more time we had to come. His heart had almost completely stopped, and his pacemaker took over, but they thought not long anymore, and he had other serious issues. When I arrived at the hospital he was hallucinating, but suddenly grabbed my hand and said, "You will not get rid of me so quickly." And he was right. The next day he was suddenly almost completely healthy, and she even told the nurse that it was nice that the whole family came. The nurse had to explain to him that this was because they thought he had only a few hours left to live. Such hospital visits are now only an annual thing. And it turned out his Passamaca is doing all the work now. But last February we celebrated its 86th anniversary, and he still has the same Passamaca. Not a doctor, but a personal story. TLDR, good chance of getting my legs amputated due to flesh-eating bacteria. Surprisingly didn't a few years ago, when I still camped as often as I could. I had some bug bites on my ankles that wore open. I figured no problem, just put a band-aid on it. It'll heal like a popped blister, right? Not quite. Between absent-minded scratching and thinking it was only minor, it only got worse. Around 6 months later I finally bothered to go to the doctor. The original sites had spread to 2 diameter with 8 more 1 spots spread across both legs up to my thighs. The official diagnosis was some flesh-eating bacteria they had to break out the book to identify, and a likely staph infection at the lower sites. At first, they wanted to amputate one leg above the knee and the other below, to stop the spread before it hit anything more important, but ended up prescribing me antibiotics and steroid cream on the off chance it might clear it up instead of just stopping the spread. Thankfully it did, and after about a year of fighting it, it was gone, and I got to keep my legs. Still makes me think twice about scratching an itch though. Third year medical student rotation in pediatrics. 4-month-old girl born with congenital HSV, herpes simplex virus. To look at her MRI of her brain it just looked like a solid bubble or water balloon. It should have gray-white differentiation and folds. The child had no higher functions. She was blind, deaf, and fed through a feeding tube. My attending told me that, because she lacked higher brain functions, the only thing in her world was touch, pain, and hunger. Beyond that her social situation was awful. Her mother was 16 and intellectually disabled. Her father was in prison for statutory rape of a minor. The sister of the mother begged her to stop the feedings and let the child pass away. Most children born like this pass away within a couple months. Some make it a few years I was told, but the mother being disabled couldn't come to that decision. This was my patient for my entire in-hospital rotation and the only patient I asked to be taken off of throughout my med school career because of how depressing sad this patient's situation was. Not a doctor or nurse, but I had an MVA in 04 and broke my neck. I was sent to a hospital in Germany because the local hospital in Portugal couldn't handle my injury. By couldn't handle I mean they couldn't figure out what was going on with their equipment. So, I flew to Germany and spent the weekend in a hotel and walking around town because the doctor on call at the hospital told me to come back on Monday. Military Doctor 03. Monday comes around and I get to see a neurologist and he sends me to get an MRI. I go back to his office to review the result and he says, "I cannot believe you walked into my office with the type of injury you have. You see this piece of paper, how thin it is. This is how close you are from being paralyzed from the neck down. This is how much space is between your spinal cord and your crushed C7 vertebrae." He put me in a bed and a week later he fixed me up. Not a doctor, but I've got 2 stories. First is my aunt. To start off, she's deaf. Always has been. She was born that way. She lives quite a ways from any big city and would often take her dog out for walks on the train tracks. Because she's deaf she couldn't hear the train blowing its horn behind her. Hit her dead on. The dog somehow knew to run back to the house and get her son. She was in the ICU for 6 months after that. I think I was young when it happened. She survived and only has a slight limp. Still walks the same dog every day. Stays away from train tracks now. Only reason she lived was because the train still had its snowplow on it, pushing her off the tracks. The second story is about a kid at my school. The exits for the highway in my area are crazy stupid. You can only exit and enter from one direction, and he wanted to go home for lunch, but didn't want to take the long way because then he'd be late for next class. So when he gets to the exit he decides to pull a U-turn. In the other lane coming towards him is a dump truck, but I guess he thought he had enough time. He ended up getting T-boned. The car absolutely totaled. It looked like a crushed can. He was in the hospital for quite some time, wheelchair for longer. The doctors told the family that he probably wasn't going to make it. And if he did, there was a good chance he'd have severe memory loss, might not be able to mentally function like he should, talk, comprehend certain things, and he might never walk again. I was at the local grocery store the other day, saw him park his car, and he got out like nothing in the past year had ever happened. Not sure how he is mentally tough. Not a doctor. But one day my mother threw up blood and collapsed in a parking lot. Multiple issues. She had a cyst or tumor in her pancreas, malnourished because stomach pains prevented her from eating, head trauma from domestic violence a couple years prior, etc. When EMTs got there, her blood pressure was 30 over nothing. NOTHING. They had said they've never seen a blood pressure that low on someone whose heart was still beating. She also lost multiple pints of blood. Continuing on, she was in a coma for a month or more, had multiple surgeries she was not supposed to make it through, 2 of them had a 99% rate of her dying during, and lost a ton of weight. After all this, she also had a stroke, and has no peripheral vision out of her left eye. Surprisingly, she survived that, and through a couple months of rehab, to learn how to walk and stuff like that. She is still alive, sober from alcoholism, and getting back on her feet after dumping her cheating, manipulative, now ex-boyfriend. I didn't almost die, but apparently paralysis was close. 5 years ago, a freak injury at work gave me a severe disc herniation of the L4-L5. After suffering with it for 3 months, seeing a chiropractor twice a week, I finally saw my doctor when it started affecting my sleep. I once asked the chiropractor if I should get an x-ray. He said I could, but he knew what was wrong. I don't particularly trust chiropractors anymore. He sent me to get an MRI, and when he saw those, he set me up with a neurological surgeon. And my regular doctor was on vacation. Never did get a chance to thank him. The neurologist couldn't understand how I could walk, take stairs, or go to the bathroom. The swelling had basically pinched off the nerves running along the spine. I told him stopping walking and going to the bathroom wasn't an option. 5 days later I had surgery. They planned to go on one side of my spine, but when they got in, they basically had to go almost all the way around. After about a year, all the sciatic pain I had been suffering was completely gone, and I was ecstatic. I had this one patient in my internship that had an obstructed bowel and had to pass through surgery. Nothing scary at that point. The incredible part is that the surgical wound opened up spontaneously due to infection. Plus his bowel opened in various orifices that opened directly to the skin, wound, and some spilled up to his abdomen. It's a really serious condition called enteroatmospheric fistula. If you Google it, you may find it pretty graphic. Added to all of this, he was in a very unequipped hospital. Before he got to the hospital, where I was an intern, guy arrives at the end of the shift extremely malnourished, signs of severe infection, labs all messed up due to the fistula and the infection. Spent almost a month and a half in the hospital, passed through a giant surgery to drain pus from his abdomen and fix the fistula. About a month after this, the nurse of the ward showed me a picture of my patient that his wife sent her. Completely different guy. That day I was convinced that my job was something really beautiful. Not a doctor, but it happened to me. I crashed my car into the bay during a huge snowstorm, then had to swim out of the sinking car in near frozen waters. It was a very isolated place, so I was not rescued for some time. Hypothermia was setting in, and I was losing consciousness when I was finally picked up. Rushed to the hospital obviously, but I had nothing wrong with me. Not one stitch, not one scratch, not one broken bone. Nothing. The windshield had shattered, all airbags deployed, and there was not one speck of blood. After a few hours I asked to be released, and they were reluctant, saying I just had a major accident, and I should stay. I insisted, and they said I needed to be seen by the chief of staff. He came down, looked at me, and just shook his head in amazement, and said there is absolutely nothing wrong, and I could go if I wanted. There was even a TV crew that came to interview me. On my way home I passed the accident site, where they had divers trying to find the car, but had called it off due to the strong current. The police divers came up to see me because they could not believe someone swam out of that and was standing in front of them a few hours after TLDR crashed my car into the water in the middle of a winter snowstorm and was back in my bed a few hours after without a scratch. Due to the age of the thread, I'm sure this will be buried, but here I go. In medical school, the one that made me say "How are you still alive?" was a guy in his mid-40s, Ike, who had end-stage renal disease. Like, the level of disease that he absolutely needed dialysis to survive. I think his schedule was every other day, or maybe every 3. He would be brought into the hospital every few days after discharge because he didn't want to go to dialysis and preferred to maintain his drinking and eating habits. He would stay for about a week each time he came in, as they would normalize his levels, and around the time he was okay he would either leave AMA or be discharged, and the cycle would start all over again. It's been a few years, but he might still be kicking around. I haven't been back to that hospital since a year before I started residency. The one that strikes me the most from my practice so far was a 12-year-old kid. Being a psychiatrist, my service often gets consulted after the surgeons and internists do the heavy lifting of saving a dying person. This kid had shot himself in the face with a shotgun, took out the lower half of his face, and left a few pellets in his cranium that I don't believe they went for because of the danger of damaging surrounding tissue. Ostensibly it was a suicide attempt. However, the brain damage he caused, or maybe just the shock of living and extreme pain, has triggered amnesia, and we had the unenviable task of trying to figure out this kid's risk level when he no longer appeared to be depressed/suicidal and didn't appear to remember that he'd shot himself. I only saw him once during a weekend follow-up before he had reconstructive surgery. At that point he was still communicating with a whiteboard because it's really hard to talk without much of a jaw. Not a doctor, SHHHHH. But my stepdad went to the doctor feeling really off. He gets there, and they run some blood work, and it turns out he's in renal failure. So my mom calmly drives him to the the doc told them to go to, that he'd be calling them to expect him to get him started on treatment pronto. We get there, and despite the having no one in it, he proceeds to wait 7 hours before someone even calls to take his information down. Another hour before he gets the triage nurse to see him. We managed to get a hold of his doctor again, and he can't believe it. He comes down, explains the situation in person, and they take him back, where they don't bother coming to see him until the following morning at 6, when another crew comes on. They start asking all these questions to verify that the entire staff the day before had failed to do anything short of taking his temp. And they start working on him point. So they take him back for a CORT scan and we don't see him for around 4 hours when they wheel him back in and he's loopy. Turns out, while trying to get a decent pic of his kidneys, the radiologist thought she saw a glimmer of something and focused on it. He had a massive aortic aneurysm that should have ruptured and killed him at any point where he lifted more than 5 pounds in the previous weeks/months/years that he had it. He did a whole lot of lifting at his job, including his huge briefcase that routinely weighed 30 plus lbs. She called the OR, and they cleared him a spot immediately. He signed all the paperwork and no one remembered to come tell the family what was going on. But, he lived. Patient, I dove into a crowded backyard pool and managed to dodge people, but shorted the deep water. I was 27 at the time, but was a lifeguard in high school, so I had experience diving in shallow water. As I entered the water, my chin was heading for the lip to the slope instead of leading me over into the deep end. I planted my right hand, left arm still extended, eyes open, intending to push myself over the concrete slope and safely toward the diving board. No such luck. My best guess is that I was moving too quickly. By planting my hand on the bottom, I changed direction, banking a hard left into the wall. I believe the left arm out is what saved me, but still caused serious damage. I didn't lose consciousness either, so I did a wonky walk to the steps and did a memory and mobility check. Things seemed fine though my neck was stiff and my head didn't want to turn to the right. Next morning I attempted yoga, a few sun salutation cycles, and I was drained. I think 2 days later my left fingers went numb, so I went to urgent care instead of work, drive. Doug, never seemed to get his last name, was the first and maybe only doctor to use expletive language. He told me to sit. I said no, that's uncomfortable. What's the news? Pinched nerves etc. He said your faking C6 is busted, and frankly I don't understand how you walked in here. You should be paralyzed or dead. So really 2 weeks off work. He had already called the down the street and even offered to drive me. The seriousness set in when I got to the and was forced to use a wheelchair. This hospital kept me in for a few days. I got to speak with med students. No one understood why I wasn't paralyzed. Finally admitted and then quickly discharged. I just go home and rest, they said. 1 month later new x-ray showed significant movement at the break in my spine. Guess we should have done surgery a month ago is not what you want to hear from your doctor. Got a new doctor and fresh fusion. It's mostly fine now. Veterinary, not human medicine. We had a cat come in that fell out of a tree and impaled itself on a stick on one side and out the other. The cat came in acting like there was absolutely nothing wrong. She was walking around, purring, and even her vitals were normal. Took her to surgery and she had somehow missed all of her vital organs. We took out a few inches of intestines along with the stick and sewed her up. She left 3 days later, as if nothing happened. Another. I had a kitten come into the animal rescue I own. His temperature was too low to register on any of our thermometers. His red blood cells, PCV, were only at 3% when normal is 30%. He was comatose, crawling with fleas, and we could feel every bone in his body. Figured we'd do the best we can for him and not be surprised if he was dead in the morning. Warmed him up slowly, gave him fluids, vitamins, dextrose, iron, treated the fleas, and a gambit of other stuff. Left for the night. Came back in the morning expecting him to have passed in the night, and he was sitting up looking at us. Gave him a liquid diet and introduced solids carefully over the next few days and he lived. We named him Mirari because we couldn't believe it. I have lots of how are you still alive stories. I worked emergency medicine for 7 years and shelter medicine for over 10. Most of them are cats lol. Not a doctor, but my dad was seriously injured once and had 5 doctors standing around making guesses on how he was alive. My dad was working to repair a court machine at a hospital and he had to have it running to make sure the repair was correct. He went to turn the machine back off and the way the hospital had it positioned there was an exposed wire that he couldn't see and his hand made contact with it. The shock was so strong that when he tried to throw himself off a ladder it wouldn't let him. He eventually blew out a 480 volt breaker. A nurse in the area heard him scream for help and she immediately called a code. The first 2 nurses who came in started throwing up because of the smell of burning flesh. His hand in places was black and charred. You could literally scrape his skin off. You could see his bones and ligaments as well, and he tore a complete hole in his rotator cuff. The miracle behind all of this is that the electricity that should have killed him in an instant never touched his heart. The only thing the doctors could come up with was that his rubber-soled work boots prevented the electricity from grounding, and that they caused the electric current to bounce back up and exit through his hand. Flash forward over 10 surgeries later and nearly 2 years of recovery, he has managed to keep all of his fingers, which they said was extremely unlikely. All his skin grafts took and have healed great, and he is back working, and he still bikes his 2,000 miles a year. The worst part though is that he was conscious the entire time, so he remembers everything. He said he just sat there thinking this is it, I'm going to die. He has never been a physical person, but ever since this accident he hugs me every time I see him. They now use pictures of his hand to teach younger guys that even with over 30 years experience in the field cheat can still happen. In summary, my dad is a complete badass. I doctor here. That's a little special because well, people suck at going to the doctor, especially men, unless they absolutely need to. For most people it's around their 40s because reading and presbyopia hit most people at this point. I frequently see men who have not been to a doctor since college and have lived awful lifestyles with terrible diets and no exercise. We are a very thorough office and include a blood pressure screening with each patient as well. Every so often I see some huge red flags, and more than once I'm afraid to say I have had patients with blood pressures of 250 plus/120 plus, or in diagnosable terms, malignant hypertension. Normal range is closer to 120/80 or lower, with low-grade hypertension starting about 135/90. The fact that they haven't blown aneurysms all over their brains is a miracle to me. My instructions: go home, pack a bag for an overpass stay, go directly to the plan for at least a one-night stay. My dad was the patient. I believe it was April 9, 2017. We were moving into our house when my dad slipped off the back of the moving truck and had popped his knee out of place. He's had this happen most of his life, nothing really new, but when my mom and I got him to sit on the steps of the house porch, he'd fallen back and seemed to pass out with his eyes open. Of course, I called for an ambulance while my mom was trying to get a response out of him. Like I said, he'd faked up his legs before but never passed out from it. Ambulance came. They were getting a bit of a response but not much. At this point, a 14-year-old me was in the house with our dog crying because I thought he was going to die. 3 days in the hospital and 13 bags of fluid later, he's released. He had critically low potassium, and according to the doctor, if he had just gone into the house to sleep on the couch like he wanted to, he likely never would have woken up. Something to note, my dad, since we move often, he would do this, would only drink Pepsi and hardly eat anything when we were moving due to non-related medical annoyances. I heard through my mom or sister that the doctor said even if he ate every banana off a tree, it wouldn't have helped much at all with how low the potassium was. Pretty sure by the time he got to the hospital, he was on death's door. Massively obese woman shot herself downward from the left clavicle into her chest as a suicide attempt. Got called in from home that she arrived in the ED after a 30-minute ambulance ride and they were coding her non-stop. I was not hopeful, but on a backup call. Drove 35 minutes, somehow still alive, and I took her to the OR after she regained circulation. We had her in the OR for 4 hours, during which the surgeons repaired a wound to her heart, her aorta, her left pulmonary artery, removed her left lung entirely, repaired her mesenteric artery, repaired an injury to her trachea, and still couldn't find other injuries or stop the bleeding. We resuscitated her with 5 or 7x her blood volume in transfusions and had a normal blood pressure during most of the case without pressors, medicines to increase blood pressure. I couldn't even ventilate her well due to her body size, tracheal injury, and lung injury. We were in or that she was still alive. After exhausting all surgical explorations, essentially clamshelling her chest open and fully exploring her belly, also performing a variant of an alive autopsy and repairing everything found, the surgeons still couldn't find where she continued bleeding from. She coded on and off in the OR. Finally, I watched the surgeons reluctantly give up, wrap her entire body in iodoform, essentially impregnated sarin wrap. We took her to the ICU to expire. Didn't know what else to do. Coded the minute we brought her there. She lasted 5 hours from her first cardiac arrest. Obligatory not a doctor. My grandfather was in his 80s when he started having bouts of dizziness, fatigue, confusion. He's a big man, so the doctors decided he wasn't getting enough oxygen to his brain. Set him up with an oxygen machine to wear while he was sleeping and sent him home. It not only wasn't working, but after a month of this, he refused to wear it anymore because he felt like he was getting worse. After about 3 months of steady decline, frequent vomiting, fainting, loss of motor skills, inability to speak, they finally gave him an MRI. As it turns out, he had whacked his head at some point and either forgot or didn't tell anyone because he'd had a slow brain hemorrhage that had been going on for months. The oxygen that they were giving him was, in fact, making it worse because more oxygen equals more blood flow. For perspective, a brain hemorrhage going unchecked will typically kill a healthy adult in a matter of days at most. His skull was filled with blood clots at this point, and he was still bleeding. Doctors got the results, rushed him to the operating table, called us and basically told us to come say our goodbyes, because odds were he wasn't gonna make it through the surgery, and even if he did, more than likely he'd end up either a vegetable or severely impaired. He made it through surgery just fine. He was awake and talking the next day, completely lucid. It was the best we'd seen him in months. Except they didn't actually manage to stop all the bleeding, so a few days later they had to open up his skull again. Second surgery was also successful, though he took a little longer to recover this time. Not only is he still alive almost a decade later, but the only real lasting damage is a loss of some sensation in his fingertips. Patient here was ambulanced to a hospital with severe abdominal pain, vomiting, etc. Second worst pain I've ever felt. I could hardly speak, couldn't see, could barely hear. I couldn't feel any of my extremities, only the pain. Assumed appendix. They did some tests and took an ultrasound. Appendix was fine. Hospital choked it up to me being overdramatic, possibly pain drug seeking. I was begging for pain meds because I thought I'd die if from the pain. They're getting ready to discharge me. I'm begging them not to. One of the doctors looks over my ultrasound and points out in the corner of the picture you can see my kidney, and it doesn't look right. They investigate whether the kidney was swollen. Why? Filled up with blood. The entire thing was full of kidney stones, so swollen it was pushing anything around it out of place and bleeding into itself. Couldn't empty cause kidney stones blocked the tube. Anyways. Figured I'd never recover my kidney function as there was literal tearing all throughout the tissue, the ureters and other tubes badly damaged, etc. Had a scan about a month ago, and my kidney looks normal. Kidney function is fine. I don't know how I recovered from that one. Probably wouldn't have died, but I shouldn't have 2 functioning kidneys now. EMT here. Was training at a local hospital. This was before COVID. My supervisor calls me over and says quietly, "Come with me into this patient's room and see if you notice what's weird." So we walk in. I assume the standard invisible position in the corner and start discreetly checking the patient out. Normal looking 50-something guy, AOX4, no important organs sticking out or anything. He's got a cannula up his nose but seems chipper. My supervisor tells me to come adjust the BP cuff or something, so I scuttle over to the bed. As I approach I see that his lips and fingers are a little blue. I think, mild hypoxia, glance at his monitor and almost shriek when I see an SpO2 of 83. For context, 83 is right above organ damage level, and that reading was with him on a high flow oxygen cannula. I gape at him, and my supervisor gives me the I know, right, eyebrows raised. Apparently, this dude came in for chest pain and mild shortness of breath. You don't say. Since he was breathing on his own and didn't seem distressed, my supervisor decided not to intubate him. I don't know what happened to him after that. Before you ask, we tried it on multiple fingers and a toe. He wasn't wearing nail polish. He didn't have Raynaud's. There was nothing that would have explained such a weird reading. This dude was just part tardigrade. Not a doctor, but I feel my dad's story belongs here. Nearly 10 years ago my dad, aged 43, decided to quit smoking and was prescribed 60 days of a new tablet called Champix. Not quite sure on the spelling. Unfortunately they found these new tablets, whilst effective, had some very serious side effects including severe depression, strokes and heart attacks. After taking only half a course he felt great and no need to smoke anymore, so stopped taking the tablets and a couple days later had what his doctor called a fatal heart attack. My dad spent a week at home in bed doing nothing but sleeping and taking painkillers. My mom, worried about his health, told him he had a doctor's appointment and if he didn't go she would call an ambulance, so he went and told the doctor he had pains in his arm and jaw, signs of heart failure. They ran a few tests which the GPs didn't understand. Fortunately there was a trainee in that day who read the results and told the doctors to get him to hospital. Just a little background on my dad: he's always worked in construction and at 43 years of age was slim and relatively built. Even now 10 years later doctors and nurses are shocked as he doesn't look like your regular patient with heart failure. After arriving at hospital and being admitted to their cardiac ward he spoke with the specialist, had several more tests before they asked what he'd done for the last week to stay alive, as the top specialist said, "You've had the biggest heart attack on a living man I've ever seen." He spent 5 days in hospital, had a stent fitted, and was given 6 months to live. 10 years and 2 more heart attacks later he's still alive and currently hasn't left the house for 5.5 weeks with COVID-19, as the virus will be deadly to him. I'm not a doctor and actually quite ignorant about the human body, but I'll try. My father had a heart event at the age of 67. Not a full-blown heart attack, but they did have to catheterize him. They took some x-rays or MRIs or whatever, can't recall the details, was 15 years ago, and told him that all his 3 major arteries are clogged. My father, who is a doctor and hence a bit more learned than me about the human body, simply stared and asked, well, then how am I alive? Turns out that, since he was an Olympic athlete, this story just gets more believable as I go, doesn't it? His peripheral arteries were developed enough to sustain enough circulation. If this sounds like bullshit, then it is just me faking up all the details, since I have no idea what I'm talking about. So he survived. He still had to go through a quadruple bypass surgery, a lengthy recovery, and adapting to a huge and permanent list of new dietary restrictions, and also a cardio and exercise regime. But as a former athlete, he was way beyond the curve on that one. However, he did return to work about 6 weeks after this happened. He wasn't able to drive on account of his sternum still recovering from being split open. Luckily, he had me, a 19-year-old, unemployed and severely depressed mooch, to drive him around for 3 months. We worked through a lot of our issues during this period, which might help me eventually get mental help, and a job, and a life. He is now almost 82 and still strong as an ox. Not a doctor, EMT. I was an EMT in my younger years, a guy who had been a career alcoholic, and I'd had a few run-ins with him over the course of 2 years. He had several minor injuries and we assumed it his normal routine. One night around 4 to 5 am his wife called and said he'd shot himself cleaning his gun point. He had 22 bullet holes that were mostly center mass and at least 2 in his face and a few in his arms and legs. Either a 9mm or 38. They weren't large bullets. Every shot's trajectory missed all the vital organs besides his lungs. Alcohol thinned his blood so much that he didn't lose any. The airways the bullets created through his lungs closed, and this guy was up screaming that his wife shot him. He lived, and shortly after the bullets that grazed his spine paralyzed him, he quit drinking and still does tattoos in US Tacoma. His wife was not charged with anything because the police were apparently used to him beating her. I'll never forget the way his skin felt. It was like an infilled balloon. The other was in US Oklahoma. Same scenario except she slit his throat. He managed to walk across the road to the neighbors. He was a heavy guy. 350k. A lot more blood that time. He also lived, but I never saw or heard anything after the initial call. My grandfather was head of missionary hospital in China during the 1930s. He told us of a patient who came in with a terrible infection that was necrotizing his arm or leg tissues. Can't remember which. He was a farmer or fisherman, so absolutely refused to consent to amputation as earning his living depended on having 2 hands and feet. Subsequently, doctors decided he was hopeless and transferred him to the death house behind the hospital, where they put patients on limited time and who received limited treatment. A week later, a nurse reported he wasn't just still conscious, but happily eating meals with decreased pain and swelling. Doctor visited to take a look, and flies had gotten into his bandage/wound and laid eggs. The maggots had eaten away all the infected and dead tissue, leaving the man with a massive gaping wound, but otherwise healthy. He told us this story to gross out the kids and have a laugh, so I don't remember how they resolved the missing tissue, but he got to leave the death house and go home, unlike every other case there. I'm late to this, but I'll add it anyway, because this woman shouldn't be alive. We have a patient at work who has very poorly controlled diabetes type 2, hypertension, renal failure, abdominal ascites. She's legally blind and wheelchair bound. She'd had an amputation of her leg just below the knee some years ago due to diabetes. These are just her major issues. So about 2 years ago she got a sore on her already amputated leg. She was in the hospital on 4th ABX and it just wasn't helping. The tissue got necrotic and she was getting septic. They determined that they were going to have to take the remaining part of her leg, what they thought would be up to her mid-thigh. Some imaging later, they realized that this dead/damaged tissue had spread, and they were going to have to take more. This woman ended up having her entire leg and her entire right pelvis removed. They basically sewed up the skin like a bag, to hold her internal organs inside her. Then recently, she ran her good foot over with her wheelchair and broke 2 toes. They weren't healing, and she needed another surgery. Last I'd heard, the surgery had gone well, and I believe she's home, trying to heal. Edit. Rental to renal. Stupid autocorrect. Incoming intern here. Saw this patient as a 3rd year med student. A 73-year-old guy is a new patient to the family med residency, where I'm doing my sub-internship. I was in the room over an hour just getting his medical/surgical etc. histories, and there's no way I could remember everything for this. About 20 years ago his one functioning kidney went kaput, so he got a renal transplant, and had been on immunosuppressive meds for years. Because of those drugs he'd had several, tens of, squamous cell cancers all over his face and arms, that required skin grafts. He'd had at least 2 strokes. He'd had a CABGX4 over a decade ago. Now for the real doozy, at some point around 25 to 30 years ago during a heart cath he had an allergic reaction to the contrast that was used, and wound up in a coma for over a week. When he finally woke he found he had no use of his right leg, so began the long process of relearning to walk. Eventually they discovered that during the heart cath his femoral nerve had been sliced almost completely. I know there's a ton I'm forgetting, but what blew me away was that, if I'd read about this case I'd expect to see someone in terrible shape sitting in front of me. But, other than the scars on his face and hands I wouldn't have guessed he'd been through so much. It was frustrating, because he and his wife had moved from an urban area where all his medical specialists were nearby to a rural area, several hours away from many of the specialists he would need for care, and had not started the process of transitioning care to any of the local specialists he would need. Unfortunately, 1 week later, when I was on the inpatient part of my sub-I, he showed up to the ED extremely jaundiced, and was found to have metastatic liver cancer. Very sweet man. I hope his family is doing well. Trigger warnings for gore and miscarriage. I used to be a nursing assistant and worked in the Philippines for a short period of time. One day, we had a young girl come in with early contractions. It turned out she wasn't going into premature labor. She had untreated preeclampsia, and it caused a late-stage miscarriage. The doctor decided it was safer, if she didn't know, until after giving birth, to prevent the death of the mother as well. Long story short, her baby had died almost a week before, and what came out wasn't close to looking human. It was completely covered in pus and parts of the body were black with necrosis. Seeing that come out of someone, especially someone her age, was absolutely horrifying. The fact that she had a dead body inside of her for so long is equally so. The mother's reaction was worse though. Honestly, I have no idea how she did not die of sepsis, or survived as long as she did with untreated preeclampsia. It's honestly a medical miracle she made it through. Throw away because this is really personal. I'm 21 meters. Gonna talk about what happened to me that made doctors ask me the same question. When I was younger, I started getting really depressed. It started when I was 13 years old and was getting worse as time went by. Problem at home, and my parents weren't the best at dealing with anything. It's just a phase type of parents. So time went on. I was 14 and I was friends with some older guys. I talked about my depression to them a lot and eventually they introduced me to drinking. I was drinking almost every day with my friends. I was always feeling out of it, and drinking just made me strange in the house. My grades started getting worse at school, and I was not sleeping enough at night. It wasn't easy at all. That's when I started self-harm. I hid it well. For my own good, hiding it was the best option. My parents would have probably hid me for it, and not done anything about it. I was cutting myself for about 2 years, while drinking almost every day. In 2014 I was hearing voices. Imagining things, like talking to people in my room, that don't even exist, and what felt like split personality disorder. I can't confirm that, because I was stubborn, and didn't go to therapy, neither had the money to. At one point in 2015, I think at the end of February, I decided I didn't want to be alive anymore and the voices were telling me I should. I looked for the best ways to commit suicide, not online only but from other people, and was talking to suicidal people at the same time as we wanted to do it all at the same time. Apparently pills and alcohol were a good way. I don't know how we figured that out, but we did. I didn't have any real drugs, so instead I mixed some antibiotics with painkillers, took them together, and washed them down with alcohol. My brain wasn't thinking straight for about 10 minutes. I don't really know how long. I cut myself on my arm, which I don't remember at all until now, and I went unconscious. All I know is I woke up in the hospital some days later. I was feeling horrible. I don't remember how many painkillers or antibiotics I took, but they were a lot. The cuts on my arm were very deep, and I have scars on them until now. When I woke up, the doctors said they thought I was probably gonna die or stay in a coma for longer. I somehow didn't. I was still depressed, and even more depressed then, but they decided to keep me in the hospital for longer, just move me to another floor. My parents didn't want me to stay, but they asked me, and I said I don't want to go back home. At the time at the hospital I met some people online, and was spending most of my time on my phone. I got therapy, but I never really told her anything. I ended up dealing with it on my own. I'm scared of drugs and medicine now. I never took them when they were prescribed to me by my doctor, and never took my therapist's advice on taking them, because I was scared I'll overdose again. I just decided I shouldn't be like that anymore. Took me about 3 years to fix myself up. I met a girl online during my time in the hospital. That was my girlfriend. Apparently I asked her then, but I don't remember. I ended up disappearing for 3 years to fix myself up, and fast forward today her and I are in a loving relationship. I'm still not 100%, but I'm stable enough emotionally, and I do need some more work to get over some fears and some things I think/dream about. I have trouble sleeping sometimes because of my thoughts, but it's nothing serious. Nothing about killing myself, at least. Not a doctor, but my brother was a patient. He had been having headaches and neck pain for a long time. We thought it was the bad pillows we had in the house. He also had this thing where suddenly his saliva becomes thick, and then he knows he's going to have a headache. He's got migraine, so we thought it was a mixture of all of those. One day he decided to go to the doctor because it was starting to become intolerable, and after going to several doctors who told him it was just a migraine, one doctor asked for an MRI scan, and so he did. Turns out there's some sort of lump that's pressing against his brain, and it had been there for about a year. They said it's usually soft and contains liquid, but because it's been there for so long it was rock hard and had to be literally scraped off. Doctor couldn't believe his eyes. He told his friends about it, and they didn't believe him until he showed them the results. Doctor also said, if he had been a few weeks more late he would died for sure. I'm not familiar with any medical terms here, so if someone could help that'd be great. Hope I was able to make it clear enough. I'm not a doctor, but my dad was in a pretty serious accident when I was a kid. He was on a construction site placing a small steel beam into some anchors in the concrete. The beam started to fall over, so everyone ran to move out of the way. My dad slipped and skidded into some rubber that was bent over at a 90-degree angle. The 1/2-inch rubber punctured his neck 3 1/4 inches. He was rushed to the hospital in the back of the client's car. It was a rural house. It would have taken an ambulance 30 minutes just to arrive. When he arrived at the hospital, the doctors didn't even attempt to do any sort of operation on him to see what the damage was, in fear of making the situation worse. They kept him for a few days to monitor the healing process and make sure it didn't get infected. The doctor said, if you could pick a spot in your neck to put a piece of rubber on and survive, that's it. My dad just chokes it up to having a small brain, thus making his veins smaller. SMH. Not a doctor, but I'm one of those patients. When I was 6 or 8 I fell from a playground slide, landing on my neck. I completely dislocated all my neck vertebrae and tore in half the right side of my neck muscles. I couldn't keep up my head anymore. Imagine the shock of my mother when she saw her child with his head dangling down on one side, crying point. Even though my dad was convinced that it was just a bruise, they took me to the ER. The doctors were shocked. They told my parents that I had only a 10% survival chance, and in a best case scenario I should have been paralyzed from the neck down. After some x-rays they put me in a neck brace, and I was good to go, still 100% functioning and walking out of the hospital with my own legs after some years. My mother told me that when we were in the hospital a doctor approached her and told her to go to pray in the hospital chapel, because the only reason I have survived was because I must had someone up there looking for me. Not a doctor, but had this happen to me. When I had gallstones, I became severely jaundiced. The doctors testing me told me my bilirubin was so far off the chart, they wished they had a chart to show just how far off it was. Some other tests came back very high as well. My doctor turned around later in the day and gave me saline, figuring dehydration was also a cause. 2 days later it was removed because I had been drinking between 2 or 3 liters of water per day, no problem. My doctor at the time was very surprised, not about how I was alive as such, but that I could move around, sit up, feel very little pain. There was someone else in the room, which was constantly asking for stronger painkillers, and her stats were much less than mine. I don't know if it was so high I could have been considered close had the doctors not been as quick as they were, but they did say that had I waited until the next day to come into the hospital, my liver could have failed. Anesthesia on call. Called for emergency exploratory laparotomy on 20-something pregnant female G1P0 at 28 weeks in septic shock. Arrive at ICU to find a patient newly arrived from ED, in extremes, still alert but somehow at once peaceful and terrified. Lock deteriorating by the minute with ongoing fluid and pressure resuscitation. Started an arterial line and additional large bore forth, and moved to the operating room. Point-induced general anesthesia with 50 mg ketamine followed immediately by RSI dose succinylcholine. ET placed easily roughly 45 seconds later, followed seconds later by widening QRS complexes and then asystole. CPR and ACLS algorithm initiated. Surgery started. Large anterior rectal perforation found within minutes. Fetus non-viable and delivered by an obstetrician. No response to CPR. T showed maybe 5% F. Dead point lookout, or window to see cord surgeon passing by after his VATS procedure in the adjoining or was cancelled. Push open the door and call him in, give a 20-second case presentation, and ask him to immediately cannulate her for cardiopulmonary bypass in the adjoining or. He agrees and calls a perfusionist as general surgery closes, and we prepare to move her. Transfer to adjoining, or with CPR ongoing. Move her to the OR table with CPR still in progress as cord surgeon cannulated and perfusionist is prepping bypass circuit. On bypass successfully, run an insane ABG with agonal rhythm and still 5% F on T. Kept on bypass for 12 hours in, or normalizing acidosis, while waiting for ECMO transport to regional referral center. Transferred successfully. ECMO weaned after 48 hours. Leg amputated a day later due to hypoperfusion from bypass cannulation. A few weeks later find her neuro intact, radiant personality, on crutches and desiring future children. This happened at a facility with no ECMO program, where CPB initiation would have been impossible had the cord surgeon's case not cancelled, and he walked by at that moment, and had the on-call perfusionist not been able to arrive in less than 10 minutes, and had the referral center not accepted the ECMO transfer. It still blows my mind. Not a doctor here, but a couple of years ago, my sil was laboring to deliver her child, and has an amniotic fluid embolism. It's a condition wherein amniotic fluid enters the maternal bloodstream, and it basically causes systemic organ failure. By the time we got to the hospital she was comatose and everyone was devastated. Her boyfriend had been told by doctors that this would likely be the only chance he had to take photos of her with their newborn, because she probably wouldn't survive. Against all odds, she woke from her coma the next day and was pissed that the first photos of her with her daughter were taken while she'd been totally comatose. She was actually born with a heart abnormality, which makes this doubly amazing to me. There was no way she should have survived. Doctors said as much. Basically, they attributed her recovery to her age. She was 17. Her body was still young and resilient. Obviously, my family are all very grateful for her surviving. We had been so broken, believing that her baby may have to grow up with her mama. Oh I can. Kinda. Answer 1 finally, but obligatory, not a doctor, but a vet tech point. We had this little decrepit Yorkie come in, agonal breathing, last gasps, shortly followed by cardiac arrest. She was a million years old, but the owner really wanted us to try everything. So we got fourth access, intubated and started CPR. Unfortunately CPR isn't super effective, despite what you see in movies, especially in super compromised geriatric patients. Well, wouldn't ya know it, the little dog suddenly gets a pulse back, sits up and starts gnawing on the ET tube. High fives all around, and disbelief. Obviously we have to remove the ET tube before she chews clean through it, a bit different from human medicine. 90 seconds after extubation, dog flops over, cardiac arrest #2. Owner doesn't want to give up. Repeat the entire process, the patient regains pulse, extubates, etc. and 2 minutes later, cardiac arrest. 3-point rinse, repeat. Point. I honestly can't remember how many times this cycle repeated. It wasn't until the doctor spoke to the owner about possible major deficits from this terrible cycle of life and death, and that the quality of life would be miserable, that she finally decided to let her friend go. Very sad, but that was one tough little pooch, and I'm pretty sure I muttered, "How are you still alive?" a couple times during the ordeal. The owner was not present for the life-saving efforts. Not a drive. Vet nurse had a dog that came in, got out the owner's yard, and was hit by a truck. Think big goods transport. Its head and face were shattered. The owner had no money, so we did the x-rays for free. You couldn't count the pieces. He wanted to save his dog, but there wasn't really much we could do, so pumped dog full of painkillers and clotting agents for the nosebleeds. When I left for the night I was sure it would be gone the next day. He wasn't. Nose still bleeding. Was sure he would die that night. Next day he stood up and started walking around. We started dribbling liquid food into his mouth and he swallowed. Still nosebleeds. Day 4 the nosebleeds stopped and he started eating on his own. After 3 weeks of mostly minimal, mostly free care, the dog walked out the front door. Skull fractures probably took months to heal entirely, but it's a miracle the dog survived the first 2 days. Not a doctor, but this happened to a family member, and to this day nobody could quite believe they survived. Point. The person was in a motorcycle accident in which they ran into another car and they happened to have a passenger behind them. The amount of internal damage caused by this was tremendous. Aside from the usual scrapes and bruises, the accident went something like this. Motorcycle impacted car, passenger with full helmet, and no brace flies forward first. Helmet impacts the back of the driver's neck around, I believe, the C4-6 range. It's been a while, causing an immediate break. Both fly forward through the bike's glass, causing a myriad of cuts. Driver impacts the car, then the passenger impacts him, causing 3 more major injuries. First, the driver's pelvis, which is supposed to be shaped roughly like a W, becomes shaped more like a. Second, since the driver still had momentum and was suddenly pinned at the hips, his torso kept going, causing a couple millimeters separation between vertebrae in his midspine. Third, that same stoppage of momentum slammed the rest of his body down into the vehicle in front of him with force enough to crack multiple ribs, deflating one lung and badly injuring the other, and more importantly his helmet, causing major brain swelling, and their bodies still kept going. By the time the ambulance arrived, the driver had a flattened pelvis, broken ribs, a deflated lung, a spine broken in 2 places, a massive concussion, had thrown a clot into his foot, and, oh yeah, no blood pressure. They were literally a block and a half away from what was at the time rated the second best trauma center in the country. Point. To this day I've no idea how they kept him alive. It took massive surgeries just for him to become somewhat stable, and weeks more of surgeries and waiting for him to awaken, and nobody was quite certain if he'd be all there if he did. But he did wake up with full mental faculties, though very few physical ones. Fortunately he was able to breathe on his own, meaning he could still talk, but that first impact made him a quadriplegic. Point. I'd like to say this story has a happy ending, and in ways it does. But those first couple weeks ravaged his body pretty well beyond any hope of repair. He was so unstable that it was almost impossible to move him consistently, meaning very deep bed sores formed very early and would impact the rest of his life. The remaining 2 years of his life were physically painful beyond comparison. But he also had the opportunity to make peace with a lot of people and say goodbyes, which I don't think most of us truly ever get the chance for. I'm not a doctor, but my husband had a brain tumor the size of a grapefruit when he was 9. The GP said he was just vomiting and complaining of headaches because he didn't want to go to school. Eventually an optician saw that something pressed on his eye from behind and he was rushed to A&E. He had to have emergency surgery to remove it. They don't think he would have lived more than 2 weeks maximum had he not had that surgery. I think he's a study in a paper and a chapter in a book somewhere. I don't think I'll ever understand how it even fit in his skull, but I'm grateful I got to meet him. Scary how close it was, and a lot of little things that changed the outcome. One of the best brain surgeons in the world happened to work at a hospital close by. Had it not been for that, and the optician being one of the best in his field, my husband would have died before age 10. He had to relearn a lot of things after the surgery, like walk and talk, but he did, and if you don't know it, you won't notice anything different about him, except a scar across the back of his head. He does have some lingering effects that will never go away, such as mental fatigue and a weakness in one side of the body, but he's alive. Not a doctor, but a friend of mine was shot in the head/neck not very long ago. He was a bouncer at a club downtown and there was a drive-by shooting at said club. The bullet went in the back of his upper neck and out through his mouth. His lower jaw was shattered and he lost a lot of teeth. But when it happened he told his coworkers not to call an ambulance because it would cost too much. He caught a ride to the hospital in a coworker's car and walked into the emergency room with blood running down his back and front and had his mom's phone number written down on some paper and literally told the front desk of the emergency room, spitting out teeth as he did, to call his mom before they put him under. Dude literally spit out a bullet and walked it off. I went and visited him in the hospital with some of my other friends. And the doctor told us the bullet went in between his spine and a major artery in his neck. He should been paralyzed or bled out or something, but he was fine. He was in the hospital for about 3 weeks and now he's out. He is on a liquid diet and has a metal jaw thing, but he still hangs out and plays Smash Brothers and shit with us all the time like nothing happened. Not a doctor, but my girlfriend is a nurse and this is probably the craziest story she ever told me from her work. One day a homeless guy is brought into the hospital with his right foot covered in some rags, with duct tape rolled all over the foot, and what appeared in severe state of malnutrition. After some questions it was clear that he stepped on some broken glass, cut the sole of his foot, and made a makeshift bandage with whatever he had around, and left it unattended for what he described as 2 weeks. So they start to open the rags, and this foul smell starts to come out, like rotten meat. The skin starts to show under the rags. It's all black, and they can't understand if it's just that way cause it hasn't been washed for ages, if it's that color because of all the dried blood that is covering the foot and rags, or the guy has dead skin on his foot. So they can't even finish unwrapping that mess when the entire foot starts to come off, like everything falling apart. The policewoman that brought in the guy just leaves the room, like I don't want anything else with that. A younger nurse almost pukes, and the doctor around is confused as how can that guy even walk on that foot. You got to appreciate this, so you can understand what I'm about to say next. His foot fell off from being rotten, he is malnourished, and possibly on drugs. And with all the calm in the world he says, a few days ago I had to pull one of the fingers that was that way, so they rush him to the operating room, and he has to loose the leg up to his knee, but somehow he survives. My girlfriend has told me a lot of crazy stories from homeless people at her hospital, but this one takes the cake. I was a patient, actually, to my preference. Female, 100 pounds, and am 5'1". New Year's going into 2019, I decided to drink way too much at a party. I had a few shots, drank a boozy lemonade, and then thought a huge bottle of Svedka between 2 other friends would really set me up for the rest of the night. I drank most of the bottle by the time we emptied it completely together. Thank God for the girl who was an EMT by chance. All I remember is waking up on a workout bench in the basement, being asked to stay awake, and if I was okay, to then slur my words so badly it sounded like I had a stroke, and then proceeded to pass out and hit my head on the floor. Woke up a few hours later in the air with all the lights turned off in my room and no one in sight. The nicest nurse saw that I was finally awake and came in to take vitals and get me what I needed. I asked her what had happened and where my mom was, and she very bluntly told me that I had partied too hard and she had to send my mom away as they were afraid I was going to die/go into a coma, and didn't want her to see that as she was extremely upset and tired. I was puzzled. I couldn't have gone that overboard, could I? Wrong. My blood alcohol level was a soaring 3.8, trying to heavily push to a 4.1 or higher. When I came to, everyone was surprised. Worst goddamn hangover I will ever faking have in my whole life. Lasted a week, and my memories from that period in time are still very shaky. I'm happy to say that I've stopped drinking like that though completely. Even having small drinks here and there still freaks me out, so I've kinda moved on from that phase. Thank goodness. Moderation is key. Ortho trauma here. When I was interning in trauma, I was called for an air ambulance. Apparently a woman was going outside to tell her husband, who was in the yard logging, to come in to eat dinner. She tripped and fell face first into his running chainsaw. She looked like an extra rare ground steak with hair, one eyeball was visible. She was conscious and obviously high up the FAC on painkillers, because when I asked her if she had any pain she just shrugged and rolled her eyes. The other time, when I was a student, we had a guy who tried to off himself with an old Nazi service pistol, put it to the roof of his mouth and shot, but forgot to take out his upper jaw prosthetic, which not only slowed the bullet so much it got stuck in his right eyeball, but also dissipated the energy by turning into shrapnel, mincing his upper face. We struggled to intubate him, so we quickly trashed him. You students? Great. Hold his legs and arms. He s not gonna like this. He did survive, but blinded himself. Probably not great for his depression. I was on call for ICU one night and they called me to come admit a guy with DKA, septic shock, and Floridads. When I got there he had already been coded, and they were busy getting lines in and getting him stabilized. His pH had come back as 6.5 on 3 consecutive checks. Glucose was over 1000. His temperature was down in the 80s and just would not come up despite all the warming measures they were trying. Only time I have ever actually seen Osborne J waves on an EKG. It did not come up, in fact, until I put in one of those cooling catheters we use for hypothermia protocols. Can also be used to warm. I honestly did not think the guy was going to make it out of the ER when I got there. But he did, and he is now walking around and back at his functional baseline. This is a good illustration of the maxim, they aren't dead until they are warm and dead, was called to a rapid response on the floor. Patient suddenly developed massive hematemesis, throwing up blood. He was in for a gastroduodenal artery pseudoaneurysm. Basically, a vessel that feeds the stomach and small intestine had a damaged wall and was just about ready to pop. He was supposed to go to interventional radiology earlier that day to get it taken care of, but had refused to let them take him down for some stupid reason, like he was pissed off about something. Big mistake. I walk in the door, just as he is throwing up gobs of half-clotted bright red blood. We take advantage of a pause in the blood gushing out of his mouth to get him intubated before he chokes on it. He loses a pulse and we start ACLS. We get emergency blood and force 4 units into him on the spot with more coming. I throw in a quick and dirty central line and we get him to interventional radiology as fast as we can. What they do is try to find the vessel on fluoroscopy and coil up a wire in there to stop the bleeding. I was told he coded 3 more times on the table down there, and they just started blindly throwing coils down there in desperation. They did manage to stabilize him, and he came to our ICU. After a protracted ICU stay, he did eventually make it out. I'm not a doctor, I'm an RN, but I have a pretty messed up story. I work in an ICU, and we had a patient come in who was pupping/peeing blood and no one could figure out why. She was also septic. This lady also had a PICC line, which is basically a long-term fourth people with cancer or other chronic illnesses may get to avoid being stuck a million times. So, long story short, I discovered this lady had been stealing used syringes from the trash, pulling her own blood from the PICC line, and then shooting her blood in the toilet after she went. She also had been injecting a weird sheet into her PICC line, so she would get an infection. I can't remember exactly what she injected, but I wanna say it was her own urine. We figured out she was a drug seeker and also had Munchausen's, which is where someone makes themselves sick or pretends to be sick in order to be taken care of by others. No one could figure out what physician allowed the PICC line to be put in, because the whole reason for it was frequent infections, yet she was the one causing them, and the PICC line made it even easier to accomplish. One of the weirdest situations I've ever been in, lol. Not a doctor, but when I got out of the military I had multiple doctors, military, VAB, and eventually some specialist from nearby hospital all tell me I'm lucky to be alive, let alone in the condition I was. I was infantry in mid to late 2000 up to 2010ish. I had all things considered really good luck. What made most of my doctors stop writing was that in less than 10 months I was in 4 different explosive blasts, 2 of which happened in the same month. And I walked away with my limbs intact. Granted that I didn't get away completely unharmed. My brain lights up like a Christmas tree in scans, and I ruptured or completely lost every disc and spine from TH7 to L5 and multiple fractures in vertebrae. OneDrive described my vertebrae as sidewalk chalk with how many fractures I had. All things considered, I left the military when one doctor sat me down and explained the severity of my situation because he figured that my dumbass was way too nonchalant about my injuries. Nad, but back in 06 my mother had a 78 pounds uterine fibroid removed. All her organs had been rearranged and she was jaundiced. If she didn't go when she did, she probably would have died within a month. She had no insurance originally and everyone just assumed she was fat, even though she looked like she was carrying quadruplets. Oh, here's another one. Vet affairs. Nurse/doctor neglected to rewrite the script for my grandfather's sugar pills. He was just starting to be diabetic, but it was managed with non-insulin meds. Well, he started having vision issues and tremors one day, tried to hide it from us. I know he was scared. His sugar at the ear was 999 plus. Normal person sits around 85 to 100. They said if his heart hadn't been strong as it was, he'd have died. Took them a while to bring it down, and unfortunately he was insulin dependent from then on. However, super crazy that he made it that far. Our staff was baffled. He walked in with us. Patient in this case, and probably not as shocking as others here, but extremely young cardiac patient on blood thinners. I got sent home from the hospital after a major surgery, and for about a week once I was home, felt like utter shit. Weirdly, I only felt better while running a legit fever. Went back to the doctors, since that clearly isn't right, and was informed that my blood was actually so thin it had been seeping through the heart tissue and apparently it had pulled in a cavity near my stomach. I'd been feeling better, thanks to a cold, because my heart was pumping enough blood that I felt normal while sick. Yeah, I'm not entirely sure either. This was over a decade ago, so my memory isn't the greatest. Basically, someone faked up the dosage of my, at the time new, blood thinner, and we didn't realize because, well, my folks were mostly just happy I was alive in the first place. Aortic valve replacement, a hell of a thing to go through at 10 years old. There's a hell of a lot more to this than mentioned, but it's all kind of a blur anymore. Patient here. I wouldn't call this life or death, but it's an interesting story on my part. When my mom was about to deliver me, they found out that the umbilical cord was wrapped 2 rounds around my neck, with my pulse decreasing. They managed to get me out. Since then, I became the sickest member of the house. I had severe pneumonia and a very low count of white blood cells. My parents would have to take me to the clinic every single month till I was 3. It got too serious that the doctors recommended I be placed in a hospital for further monitoring and treatment. This was in 2000 at the hospital. They took an x-ray of me and they literally couldn't see my lungs and rib cage. It was all frozen up in me. They tried various methods to get a sample out of me. Things like hanging me upside down and massaging/tapping me would not work. They even tried various nebulizers which even made my dad, who sat at a distance, vomit. But I refused to give a sample point. They nearly quit a week later, if it wasn't for me randomly coughing due to some food I had eaten. I was young and this was years ago, so I forget a lot of the details, but basically my mom should have died. She was sick with pneumonia, but didn't know it, and when my dad went to work he told her not to go to sleep, and to call if she was feeling sick. When he got home she was asleep in bed with her neck ballooned up and barely responsive. He said they needed to go to the hospital, and she was trying to say wait until the morning, but he forced her to go. When they got there they immediately were shuffled into an emergency waiting room and they were waiting to do x-rays or something, so the doctor said there was no food or water. My dad knew it was bad when the doctors came in and told them he could give her whatever she wanted because she kept begging for water and her health was clearly that bad to the doctors. They took her in that night and immediately intubated her, and the doctor told my dad if they waited until morning she would have died. They ran a bunch of tests and basically couldn't really figure out what was wrong besides pneumonia, and she was going sepsis, so they induced a coma for I think it was a month and they were doing dialysis on her, and some other things. She was in the ICU the whole time, and at the end the doctor said they have no idea why she was alive or even that sick and her records are basically a case study now. My dad once experienced massive internal bleeding in his skull, rupturing his brain. He became knocked unconscious and was out of work for a year, in hospital recovering for 4 months of that. This was well before I was born. But basically, he was down unconscious on the floor for possibly up to 2 hours as estimated by the doctors, before my granny started to get suspicious and rushed over to see him in his apartment, saw what happened, and dragged him to her car to go to the hospital. Luckily, they had the top neurosurgeon available to tend to him to remove most of the blood, but it was something like a 3% chance of survival, almost no chance of actually making a full recovery. Miraculously, he survived, and they managed, through difficult operations, to try a new technique that was only being prototyped at the time by other colleagues, and they managed to give him a full recovery. I will always give great gratitude to that neurosurgeon who saved my dad's life, even though he wasn't my dad back then. Super late to the game, but wanted to tell this story anyway. Not a doctor, only a patient. I, at the time 19F, was having these weird dizzy spells for about 2 months accompanied by slight chest pains. Pushed off calling my PCP because I just hated doctors, and I was honestly fine, no. Finally my then boyfriend had me call my doc to set up an appointment. I called up, telling them what was going on. As soon as I paused to hear my appointment, that was totally going to be in about 2 weeks, the nurse asks how soon I can get there that day. I say after I'm off work in an hour. I go in and immediately get escorted to a room and they have me put on those aprons so they can do an EKG. Machine comes in seconds later, and the nurse runs my EKG. Read the results, and tell me I'm having premature ventricular contractions and some other cardio issue that's really bad. Sorry, I was in some sort of weird shock and kind of blacked out. The doctor comes in, and is just super quiet and confused. She basically tells me she doesn't understand how I'm acting like everything is fine. Notifies me if I exert myself in any sort of way I will go into cardiac arrest and die. Tells me she's going to send me to the cardiology wing and send over a referral stat to get a heart monitor put on. I get escorted over to cardio. They tell me they don't have anything for me and to just go home, and I'll hear something in the next hour or so. An entire month goes by before I hear anything from anyone. I called my PCP, cardiologist, nurses, and the hospital. No callbacks. Finally get in to see the cardiologist. They hook my monitor up 48 hours and I'll bring it back, and they'll read it. They tell me they couldn't read anything on my monitor. There was nothing wrong with me. My PCP read my EKG results wrong somehow. Get sent to do a full blood panel. Find out I have a sodium deficiency causing my blood pressure to randomly drop when I'm low. Similar symptoms to anemia. Cardio tells me to take salt tabs, and I'll be fine. I might be late to this, but oh well. I have had primary sclerosing cholangitis since I was 5 and a side effect of that is you develop varices in the back of the throat, Protruding veins. Well, a few years ago they popped and started bleeding. For those of you who are unaware, you can be pretty severely anemic with liver diseases. At this point it has developed non-alcohol related cirrhosis. In top of this, since I felt like I was in pain and had a bad headache, I just had to take an ibuprofen. You really don't know a virus popped until you pop. Not going to go into that one. So I felt like absolute shit, was extremely tired, weak, and not feeling good at all. Well, I was taken to the hospital. First thing they did was look at me, rushed me into a room, since I was looking super pale but super jaundiced. Turns out my hemoglobin was 4 any lower and I could have been on a quick slope to bleeding to death. I had 5 blood transfusions before they felt comfortable giving me an upper scope to cauterize the damaged vein. I sold my soul when I was on a rollover car wreck with people ejected on the interstate. I was standing waist deep in ditch water holding this lady's head out of the water, stopping her from drowning. She was particularly ejected out of the passenger side window. One of her eyes had popped out of the socket and was hanging there. She was semi-conscious and mourning. I'm freezing my ass off, by the way, even though it was a summer night. This back in the 90s. I was just on the FD and a basic EMT with zero experience. So I'm stuck. I can't help cut her out, so I'm just talking to her, trying to keep her awake, freaking out on the inside and shivering on the outside. So we got her out on a longboard and were walking up the muddy embankment, and there's tons of bystanders including a group of Boy Scouts that helped us get her up and into the ambulance. The ALS crew just arrived and the paramedic yelled out sheet to do for her care. They closed the doors to the ambulance and spread off. I remember them getting on the on-ramp heading over the interstate. I'm standing there freezing my ass off in amazement and I knew I was hooked. Not a doctor, but a few cases have happened to me and family personally though. I was in a car accident. A car towing a caravan had decided to do a maneuver in a road it shouldn't have without any warning. Cue everyone slamming on the brakes, and we managed to brake. My ex's dad, being a really good driver and come to a almost complete crawl with everyone else, car in front was a 4x4 of some kind, and before I know it, we are hit into. I can only remember thinking about what type of sandwich I wanted, and the next thing I was coming to realizing this was bad, and I needed to get my shoes on and get out the car. Didn't realize how bad till the doors were jammed shut, and it was my ex's dad who managed to get us out with the help of some off-duty service people who happened by luck to be there. The car was all sorts of messed up. So it turns out the driver wasn't paying any attention and was going too fast for the road we were on. He was also in a 4x4 and we were in a hatchback, can't remember the kind, so we were rammed forward and then sandwiched between two 4x4s. Police officer who attended was shocked that minus concussions, bruises and whiplash was all we all sustained, to which he informed us if the driver behind us had been 5 miles per hour faster, me and my ex who were in the back would have been Jame. I have no idea how we got out of that with as little injury as we did. So I have 2 stories where I was a patient. The first one was when I was 2 to 4 years old. So my mom was knitting, and I took her knitting needle and put it in my mouth first and turned to run, but there was a walk in the way. My mom took me to the ER and the nurses kept asking if my mom say any blood in my mouth. There wasn't any. Then they patched me up the best they could and told my mom to take me to the family doctor the next day. The family doctor told my mom that I had almost pierced my carotid artery by less than a centimeter. Not entirely sure if it was to the side or straight through though. Second story, so I was around 5 to 7 and I had been having this really bad cough for a long time, and eventually my mom took me to the doctor. He said that everything was fine, but my mom pushed him to do some more tests. He does a blood test and my iron levels are at like 2 or 0.2, not sure how it's measured. So apparently the reason I had the cough was because my body was trying to restart my heart. After that doctor's appointment I started to have to eat a lot of vitamins and steak. I was 21 mo old on the 31st December 1982. My parents' living room had this lamp that was on a table on the left side of the sofa, but the power outlet was on the other side, so for security and keeping electrical stuff out of toddler reach, they run the cable under the sofa cushions. That cable was one of those fancy 3-way crossed fabric covered cables, so my older brother and my grandma were on the balcony watching fireworks and left me unattended on the sofa. I found the cable and started chewing it for good. I eventually reached the copper and that was it. With the power out, my grandma scrambled to fetch me and check everything was okay. She didn't find me on the sofa and she could not see where the heck I was. The only thing that was obvious was a strong burnt chicken skin smell pervading the room. It was only for my brother, 6 at the time, that they found me on one side of the sofa, half a meter away. For what they could know, I was at least passed out, at worst dead. They called the ambulance without knowing why. They didn't realize what happened until they returned home from the hospital and couldn't restore the main power switch without unplugging the lamp point in the meantime. At the hospital, the tip of my tongue was becoming white and swollen, like 5 times normal size. I wasn't able to close my mouth anymore. Some days later my tongue tip fell off on its own, and to this day I'm tipless, if I could say so. Faking grandma. I'm not a doctor, but my great grandpa was a case of how the fuck are you not dead. He lived in those very closed hospitals for old people. I'm not a native English speaker, don't know what they are called. We visited once in a while, but his health was declining rapidly. He had prostate cancer, Alzheimer's, vivid and repeating hallucinations and way more. The doctors and nurses were trying to take care of him as much as possible. My mom and grandmother were the ones who visited almost every day and got informed about all the things that had been happening. Me being around 10 years old, I was very curious as to how he was doing. Sometimes when I woke up my mom came with horrible news, like he fell down or had horrible hallucinations. I lived in a constant state where the nurses said he didn't have long to live, but didn't die in the estimated time span they said. He just kept going. He barely remembered any of us, but it seemed like he really didn't want to die. Then, one day, the nurses said he wasn't doing too great, but still had quite some time left. My grandma was staying the night there to watch him, and suddenly, she heard him take his final breath. The nurses said he had at least 2 months to live. He died 2 days after they said that. Everyone I meet I went through the windscreen of a car at 70 miles per hour and the seatbelt locked as my head went through, leaving me scarred, blonde in one eye and at B point had an ectopic, and woke up with no anesthesia. She forgot. Had a child and we both died, and had to be resuscitated. Had a hysterectomy, and he left an internal bleed. My iron levels were at 2, and I was 24 hours away from total organ shutdown. Had a cancerous tumor the size of a honeydew melon, but it hadn't spread, but damaged my stomach and half had to be removed. Also damaged the bowel, and has left me in constant pain. Got Addison's disease and actually went into Addison's crisis when my BP dropped to 50/20, and they still wouldn't formally diagnose me. When they did, my levels were obviously really low. Went on steroids and had another test, and they said I didn't have it and was fine. But I had no sleep and they didn't know what steroids I was on. Had another crisis, and I had a vial of cortisol, self-injected, and within 10 minutes I was fine. But my endocrinologist doesn't like me, and vice versa, so she kept coming out with pathetic excuses. I'm sure there's more, but those are the main ones. Got over 1 meter of scars on my body. One I can answer. I'm not a doctor but a patient. I was in university at the time and my sister and I were driving cross country to go back to university. I was taking a nap with my knees on the dashboard point. While she drove she got scared when an animal dashed in the road while driving on the freeway going 80 miles an hour and overcorrected. Next thing you know the car is rolling over on the freeway. Car rolled 4 times and the only thing I remember is screams. I had 2 collapsed lungs, a concussion, broken legs from the airbag sending my legs into my chest, and 1 broken arm. I was airlifted to the hospital and pronounced dead on arrival. There is even an article of me announcing I died. I was in a medically induced coma and not expected to wake up. I woke up after 5 days and had no memory loss or brain damage at all. I was in the ICU for about 10 days. Then about a week after that I was released. Not one person we encountered could understand how I lived. They said no one walks away from crashes like that, while both me and my sister did. She had nothing but scrapes and bruises and a killer headache. Oh, my dad. About 14 years ago he had a brainstem bleeding, and the doctors found out 5 years later. He got a brain pump thingy that was poorly installed and broke about a year later. From then on he had many seizures and insults every autumn and winter. A few years later they tried to remove the device, which wasn't successful. After that he had 2 major seizures that actually caused him to die and come back alive within 5 minutes. His lowest recorded temperature was 25.8 C, and he still can't get temperature above 34, or he might get seizures again. He can't produce above normal levels of adrenaline because it is lethal to him. When it all started the doctors gave him 6 months maximum, but he is still proving every doctor wrong. The only good thing of all is seeing the face panic when a new doctor tries to temperature him and realize it is so low he should fall in a coma, and we just really relaxed around joking about it. Not a drive, but this applies to my dad. One day my father had a bit of pain in his chest and went to the doc since he had previous heart problems. He walks in, asks to see the doc, and says what's going on. The doc thinks there might be a small plaque buildup in one of his heart tubes, can't remember the name of it, so he gets some tests done on him. Turns out that he had a 99% blockage in the most deadly tube, and they did a quick surgery over the weekend. By the end of the weekend, he was back to his 60-hour work week. The doc expressed how he and all the other docs had never seen or heard of a case of someone surviving a 99% block, not to mention walking into the hospital calmly and not doubling over in pain. My dad is also known for having a 3-day heart attack and only complained of minor pain in his chest, accidentally drilling into his hand and pulling bone fragments on the drill, only to laugh at and bandage up to get back to his project and other superhuman acts. Apparently his dad was an even more extreme version of this, hammering nails in with the palm of his hand, lifting an entire engine out of his 64 Plymouth, and as a 60+ sub 140 pounds man breaking 3 ribs of a boxer in his prime with one punch. Patient here had a misdiagnosed giant hepatic 13x11 cm hemangioma that had pendulated from my left lobe. It was found during an ultrasound when I was 20+ weeks pregnant. After MRI and a biopsy, that probably should have killed me because it's a vascular tumor. I was told I had lymphoma and then another type of incurable cancer. Luckily I was single, alone and pregnant. There were discussions about terminating my pregnancy and starting chemotherapy immediately. I decided to see my pregnancy through and deal with this thing after fast forward 6 months and many other Microson nuclear imaging and discussions of rare cancer. I'm sent to the Huntsman in Utah. They are the only doctors who would even operate on my liver. I come out of the liver resection surgery and something isn't right. I keep telling the post-op nurses something isn't right. They told me where, and I pointed to the 12+ inch incision that runs down the middle of my chest to my belly. I'm sure they thought I was nuts. Fast forward 4 to 5 hours, and I'm still not stable. They move my bed to keep blood in my brain. They think it's blood clots. I then remember every detail like time stopped. My heart rate is all over the place. I was cold but unbelievably calm. The doctor comes in and starts yelling they need to give me an emergency blood transfusion immediately, and there's no time to wait. Small detail: Huntsman does operations at the university hospital next door. The doctor said there's no time for an ambulance to transport me. It's just next door. And to call the guys from the parking garage to run my journey through the parking garage to emergency surgery. I remember the cold air hitting my face as parking attendants ran me into the operating hospital through the massive parking garage. Second surgery. Spurting artery in the liver found and repaired. 6+ units of blood. My cavity needed packed from all the blood loss, which broke a rib. 5 days ICU, and then I got to come home to my baby. The tumor would have killed me, so despite everything I'm so grateful those doctors took the risk to save me. Was a nurse once upon a long time ago. I worked in a nursing home that accepted more than just elderly. First day of orientation I met Richard. He rolled up to me and asked who I was and what I would be doing there. Basic get to know me questions. Nice as can be. Second day of orientation I found out the guy's story. Turns out he wasn't so nice. Apparently he was an addict and owed some bad people a lot of money. He also talked a lot of shit. Even in the nursing home, not a single employee had not been called a beach, cunt, ho, you name it. Apparently he talked shit to the wrong person one night. A group of guys beat him to within inches of his life. Paraplegia and all of his teeth knocked out being the result. Then once he got to the nursing home he was so mean he wouldn't allow staff to turn him. I swear he had no way, just a huge pressure sore where his eyes used to be. Seems like the mean ones just refuse to die. I also worked with someone in a different nursing home with the same story. Only difference is he had no function of one of his arms as well, and he had such bad head trauma that he didn't know / wouldn't accept what had happened to him. Let him tell it, and he got into a bad accident driving his hot rod. Not a doctor, but I worked at a turkey slaughterhouse for some years. The birds are processed by first putting them through a CO2 chamber to knock them out. They are then hung upside down on shackles run by an overhead chain line. There's a big pizza cutter on a motor that slits their necks, and they are moved through the blood tunnel, where they bleed out. They then get to the scalders, which are hot water tanks that loosen the feathers. After the scalders come the pickers, which are a bunch of wheels with rubber fingers on them that pluck all the feathers out. Then they go to the hot cutter, where the bottom parts of the legs are cut off, and they are dropped down to a table and rehung on the evisceration line. The first stop on the evis line is the sheet sucker. A guy who sits with an instrument with vacuum on it that he shoves up every turkey's, but to suck the sheet out. After that, the removal of the inner organs and necks happened. One day, a bird survived all the way up to the sheet sucker. Alright. Now I, a doctor, of the medical variety, was recently working, as you do, at a hospital. As I was scrubbing the lobby windows a patient came in. Full disclosure, age 45. Height, male. Weight 88.871 kilograms. Dog, Labrador. I asked him what his name was, standard procedure, and what was wrong with him, standard procedure. He responded with Darren, and I don't know, respectfully. Now this was very perplexing. You see, as a doctor I'm qualified to diagnose patients using my medical ability and expertise, but this patient was proving very difficult. I looked him up and down, and on each side, but I could discern nothing abnormal or threatening about his condition. Even looking at him from up higher, on, as they say, a catwalk, I could make out none, ailments assailanting his person. I called my 6 medical colleagues, all but one of whom were also Dr. S, only one being a janitor, full disclosure, some of which look at the soles of his feet from below, while present within the observation platform, and even then no L's could be finger putted on. After 3 hours and 45 minutes of us, the doctors, clambering about him, Mr. Douglas, he had kept my last name despite divorce, informed us that, and I quote, was here to visit his grandmother, who was dead. You fool. You idiot. You are here to be diagnosed and have surgery. I led him, using my dominant hand, further down the corridor to the operating table. I informed the chief surgeon that we had been unable to ascertain the troubling situation he was experiencing, and so we decided to skip straight to this step. Okay, were the words out of the Surgeon General's mouth, as a silly patient, who you have, I'm certain, developed sympathy and emotional attachment towards at this juncture in the story. Laid down onto the bed and slept. I watched, perhaps a little overzealous, I admit, as the surgeon fished out the tumor in his lower abdomen. When the man awoke, there was not enough left of us to comfort him. Anyhow, the moral of the story is, when dear Dallas was being silly and not wise, unwise is how that is said concisely, I did whisper under his breath, and I quote, how the fuck are you even, still alive?